All right, people should be joining in soon. Okay, guys. We're just connecting everything. All right, perfect. All right, good morning, everybody. I hope everybody's doing great today. I wanted to do this free webinar for everyone. If you're joining us, we're going live on Instagram. So you might see me kind of talking between IG and YouTube. Just give me 1 second here. So we're going between Instagram Live, YouTube Live, and try to bring this to you guys so we can talk about how to score 270 on the USMLE. Okay, this is gonna be a lot of fun. Hello, everybody. How you doing? Okay, so today's a special one. So if you're watching me right now, you're probably gonna be watching me live on Instagram, or you're probably gonna be watching me on Zoom. If you want to join me on Zoom, click the link in the bio right now, either at Smash USMLE, so you can join me live on Zoom. We only have a limited amount of spots on Zoom. So if you guys are watching live on Instagram right now, I'm also on YouTube. For people who are watching live on YouTube right now. So guys, join the Zoom call. It's actually a combination. So you can either join me live on Zoom or you can join me live on, you can continue to watch me on Instagram, but I'm going to be sharing a lot of things on the screen for you guys. So for some of you who have never, who want to join the Zoom call, literally just click the link in my bio or med school bio right now. And then you can join me live on Zoom. Okay. All right, so I'm going to be sharing a lot of important information today, so make sure you guys take a lot of notes, okay? If you've never joined our program before or actually watch me live on Zoom or watch me on YouTube or Facebook or Instagram, my name is Dr. Adishina. I'm the CEO and founder of Smash USMLE Reviews, and I've been teaching USMLE Press for the last 10 years, probably 11 years plus now. And literally, I'm here to be able to share with you how to score 270 on the USMLE, secrets that they never share with you. So I'm also a board certified emergency medicine physician. I work at the hospital as a full-time ER physician. And literally, I'm also, I'm a dad. I got 3 boys and my wife. And literally, I'm really passionate about helping students pass the USMLE. Like, I am obsessed about helping you becoming a better doctor and giving you the tips and the tricks that you're not going to find on the internet. So if you're watching me live, like I said right now, okay, make sure you can join me live on Zoom. There's a link right now on Zoom. If you go to @SmashUSMLE, that's my Instagram handle. You can join me on that, or go to IG for Med School Live. You guys are watching Med School Live. Click on that link and join me also. Through the Zoom call. The Zoom is free, so just click. You just guys register your name and your email address, and you guys can join me live. There's only a limited amount of spots on the Zoom, so once the link is over, then you can only watch me on Instagram. Now, what I'll try to do for you guys that are watching on Instagram right now, we have a lot of people on IG. I'll try to share my screen so you guys can see also what I'm doing on the PowerPoint presentation while this goes on. And I hope you guys learned something today. Okay, you're gonna walk out with value. That's what I'm here to give to you guys. Okay, now. Let me just pull up my PowerPoint slide. So just to kind of give you guys an idea of what I'm going to be teaching you guys today, let me share my screen here. Let me see if I can pull this up. All right, present me. Let's see that. Perfect. So I'm going to share my screen. And if you can't see, just let me know. And if you have questions, all right. So for some of you guys, I know a lot of you guys have questions for me. You can put it on the Instagram chat. Now, if I'm not able to get to your question, try to post it into Zoom. So if you want to join the Zoom right now, hop on the Zoom call. For everyone that's on Zoom, post your questions in the chat and I'll try to answer them as we go along. Let me know whatever question you have. Feel free to ask me anything, literally. This is a free call. So give me 1 second. So also if you're on YouTube, you can post your link in there, any questions that you particularly have for me so I can be able to answer some of the questions. We're going to be doing USMLE questions together today. I want you to participate. All right. Don't feel shy. All right. Nobody, everybody's smart. You guys are doctors. I want you to participate. So make sure when we start doing these USMLE questions, I want you literally try to answer them because you're going to learn something from that today. Even just the little questions I put together, I'm going to show you some of the tricks that I use that allows me to learn information faster and also connect the dots. All right. So make sure you participate. Okay. So if you're in the Caribbean Medical School and you have questions, literally post it in the chat for me. And we're about to get started. I just wanted everybody to check in. And this is going to be a lot of fun. I'm really, really excited about this. Literally, I said, I really wanted to give you guys tremendous amount of value. So let me just pull my screen up here. I will flip the screen for you guys who are live on Instagram so you guys can be able to see what I'm doing because you may not, it's a big screen, so you may not see the whole screen, but I'll try so that you guys can be able to see everything that at least I'm doing right here. It's gonna be a bunch of stuff on my screen here. So I have to keep track of so many things because we are on 3 different platforms, but this is fun. I love it. All right, let's get it. All right, let me share my screen here. Can everybody hear me clearly before we start? I just want to make sure everybody can hear me clearly. If you can hear me clearly, say yes in the chat. I just want to make sure my audio is working perfectly. I'm just set my mic also. Let me know, just make sure like the audio is good before we get, okay, perfect. Bobby Kent says yes. Abraham says yes on Instagram. This is perfect. This is great. All right. So we're going to talk about how to score 270 on the USMLE. And I'm going to flip my screen for you guys who are on Instagram so y'all can see what I'm doing. IG is always funny, but let's see. Geez, it's going to be interesting. Let's see how we can get the right angle for you guys. We're on Instagram so you guys can actually see my screen. All right. Let's find a spot for y'all. Okay. So let me see if I can, how do you zoom this out? I just kind of want to zoom it out for you guys so y'all can see what I'm doing. Okay. It's kind of zoomed out too much. All right. Can have the guys at med school live, you can mute yourself. Okay. All right, we'll just put it right here, maybe. Okay. All right, guys. So welcome to the webinar today. We're going to be talking about how to score 270 on the USMLE. All right. So here's one of the most important things that, I've been working with IMGs for the last 10 years. And I wanted to share with you some of the things I've noticed when you're an IMG and you're studying for the USMLE. Okay. If you're an IMG and you're already practicing medicine in your country, for example, let's say, you've been practicing medicine. Maybe you're a doctor that's already working clinically, a neurologist, an OBGYN. I want to say yes in the chat or kind of, put it in there. Like, I'm kind of curious. I want to know if you guys are, some of you are already clinicians, you graduated an MD degree, or you've already graduated with MBBS in your country, and you are actually, coming to America, or you're trying to come over here to be able to practice medicine. Because I wanted to debunk something with you guys today. Okay. So one of the things, I've worked with thousands and thousands of people, and there's a common trend amongst IMGs, and it's not your fault. Okay. Let me just preface that. It's not your fault. So if you train in India, if you train, anywhere else outside of America, then something you're going to notice is that medicine is kind of like, everybody's taught medicine all across the world, but every country has their own standard of care. So one of the things you have to understand is when you come to America, we have clinical guidelines that are written specifically, all right, and that is designed to teach you exactly how to practice medicine in the United States. So here's the deal. If you don't learn the way we train here in the US, guess what? You're going to struggle. So one of the things you have to do when you come to America, right? So as a physician, if you've already started practicing medicine before, I know you know the clinical stuff. I know you've been doing surgery. I know you've already practiced medicine. You've done your OB-GYN, you delivered babies, you're a neurologist, you've done all this in your country. But when you come here, the first big mistake IMGs make is that they have an ego. And we all have an ego. I have an ego. You can't go into medicine and not have an ego. But the problem is, do not let that ego get in the way of your learning of how we want you to learn the information for the USMLE. Because the problem you're going to run into is a lot of people have what I call intelligent ignorance. Intelligent ignorance is somebody who came to America and say, hey, I was the top of my class in medical school when I was in medical school in my country. I come to America. What's this USMLE stuff, right? I can knock this thing out. Now you just picked the wrong attitude. The first thing you have to do is declare what I call knowledge bankrupt. Knowledge bankrupt is basically saying to yourself, listen, although I'm a clinician in my country, I practiced medicine for 10 years or 5 years or 8 years. But remember, medicine is ever evolving and changing. And when you come over here to America, and you want to learn the American healthcare system, presume and assume that you don't know anything, because that is the only way you're going to learn something new. Okay? Alvin Toffler said, the people who are, who are going to change the world, or who are the, well, actually, that's not what he said. He said, the illiterate of this generation are not the people who are the people who are unwilling to learn, relearn, and unlearn what they've learned. And I'm begging you today to understand that. Please presume that you don't know anything, because that's the only way you can open your brain up to possibilities to learn brand new information, because the USMLE is just a completely different beast. So you see right here, the first thing that says, declare yourself knowledge bankrupt. If you do that, automatically you open the possibility to learn something new. The problem is each one of us come with a preconceived notion of what we think we know. And that always affects IMGs significantly to make progress as they're studying for the USMLE, because you are making a lot of bad assumptions. You know what they say when you make assumptions? You're wrong. Number two, don't assume you know anything or know everything. The information is insane. It's a lot of information for you to learn. And early in the game, you literally start to say, you know what? There's more for me to know than I think I know. I've forgotten a lot of stuff. I need to relearn a lot of new things, and it's okay. Just be humble about it. The third thing is we have to set goals. You have to set, and when I tell people to set goals, the people who fail to set goals in life never achieve anything, right? And for example, let me go here. When I tell people to set a goal, I tell you to set a goal that feels almost impossible. When you say, okay, I'm studying for the USMLE, don't set low goals like I want to pass. That is a big pit hole that you just dug yourself in. Because if you say I want to pass, you're setting yourself for failure. I have seen this over and over and over and over. Okay. And understand that literally, that if you set a big goal, if you set a really, really big goal, even if it seems impossible to attain, it allows you to work harder to get a higher score, right? So for example, USMLE still has a 3-digit score. And if you're going to be taking it this year, until January next year when it goes pass fail, you want to set a high score for yourself, because the higher you set the bar, the harder you have to work. This is just mindset, all right? Now, if you say, oh, I just want to pass this test. Well, guess what? If you pass the test, you are setting yourself and making the path even harder, because for IMGs, higher scores means higher chances of getting interviews. If you fail and you didn't pass the first time, you can still match. The road is just harder, okay? Now, the other thing is that you need to understand is that when you set these goals, you need to write them down. I'm a big advocate of writing things down. When you write things down and you put it up on the screen, like on a piece of paper, I say, my USMLE score is going to be 270. In your mind, trust me, everything in your mind is going to be telling, oh my God, this is hard, this is impossible, but you can do it. Even if you don't hit a 270, what if you hit the 250? What if you hit the 260? What if you hit the 240? What if you hit the 235? At least you set the goal high enough for you to be able to understand that, wow, you know what? I give it my best shot, and guess what? I got as high, as close to my goal as I want. Okay? So it's very, very important that you guys understand this concept of setting goals. Okay? Now, you see here at the beginning, I talk about be realistic with your study timeline. The average time it's going to take an IMG to study is between 6 to 18 months. Average, 12 months. People are going to tell you you can do this in 3 months. It's a lie. You're fooling yourself. It's not going to happen. All right. Literally, it is going to take you probably, depending on if you're working or not working, if you're part-time or if you're full-time, if you have children, if you're single, if you have somebody taking care of you, it is probably going to take you an average between 6 to 12 months just to take one of the steps, right? Now, I've seen people done it in, 6 months, but everybody's different. So you need to know yourself. And that's what we do with you at Smash Fest. We work with you to try to figure out what's the best timeline that we think is going to work with you as you work along with us. Now, I talked about this in our last webinar, and I think this is an important information that a lot of people don't even understand. Understanding the match cycle. So we had a webinar maybe like a few days ago, and I went over this match ERAS 2022 timeline. All right. So if you guys are watching live on Instagram, like I said, if you don't like the screen, you can click on the link with Med School and join me, by clicking the Zoom link, and you can be able to, join the live Zoom call. Okay. Look, right now, May 31st, 2021, right? That's when the ERAS, that's the electronic residency application system, ended, and people who have matched into residencies actually already starting residency right now. June, this is June. They all start July 1, but they're all doing orientation right now. So guess what? As of June 9th, ERAS has opened again and the new season has begun. So you need to know where you fall into and which cycle do you want to apply to, because a lot of people say, I want to apply to residency this year. If you say you want to apply to residency in 2021, you may be behind the 8 ball if you don't have everything ready before a certain date. And I talked about this in our last meeting, if you guys were not part of it, that listen, people are filling out the ERAS applications as I'm talking to you guys right now. There's 40,000 applicants that applied last year. 55% of IMGs matched. So guess what? Right here, you can see September 1 is when you can begin to submit your application. That is an important date for you to know, because if you're taking the USMLE, let's say somebody's studying, you've taken step 1 right now, right? And your scores has come out in June, right? Which means if you're going to take step 2 CK this same year, you have probably maybe under 3 or 4 months, June, July, August, September, your step 2 CK score might, let's say you take, step 2 CK in September and your score doesn't come out until October, you are going to fall behind the 8 ball a little bit. You can still apply with your step 1 score, but listen, you're going to, as an IMG, you need to take step 1 and step 2 CK and OET. Sometimes you have to take step 3. If you have a high USMLE step 1 and step 2 CK score, you're going to match. If you have a slightly lower, you're going to need all 3 because they're going to screen you out. Okay, so right here, September 1, you guys should be applying and submitting all your applications by 9 a.m. in the morning. People are literally waiting 9 a.m. and they're submitting all their applications, which is all the residency program directors are going to get this information and they are not going to look at it yet. It's just going to go into the cloud waiting for September 29th. So if you want to apply to residency this year, guys, literally September 28th is your deadline, because that's when residency program directors are going to see all the applications and start reviewing it. It's a first come, first serve. So if you want to get into residency this year, make sure you have your step 1, step 2 CK and your OET ready so you're applying, okay? Now, here's the life cycle of the match, okay? Kind of put this right here for you guys to see. You see, June, right? That's why I say June, right? People are already submitting applications, right? ERAS open in, they're already submitting their ERAS application September. So October, this is when people are getting invited for interviews. You start to get calls, you have to travel, but right with COVID, you don't have to travel. With COVID, it's all virtual. And then listen, people start submitting their rank lists by January. And guess what? February, rank list is due and the match is in March. Know this life cycle, guys. Super important. I put the link right here for you guys, okay? Now, we're going to dissect some USMLE questions because we're going to talk about how to score 270. And I keep teaching this concept over and over because I want to hone it into your brain until you fully understand it, okay? So we've talked about some of these common mistakes, in our program, but if you're joining us live and this is your first time watching this, listen, this is one of the most common mistakes IMGs make, or just medical students in general. It doesn't even matter if you're an IMG, right? And you're studying for the USMLE. Here's the challenge. The exam is a standardized test. A standardized test means that the questions are written in a specific format that actually predicts and can allow you to pick either the right or the wrong answers based on how I write the question. And it's standardized all across board because it's the strategy of how we write the questions. They are not written like medical school questions because it's a comprehensive test and it's an integrated test, which means I can determine whether you know information based on how I present it to you on the screen. Okay? So here's the problem. If you don't have a systematic approach to the USMLE, you are going to struggle. That's why IMGs struggle with the USMLE. 78% of IMGs pass in the first time, okay? And that's almost like, that's 20-something% actually failing on their first attempt. We're not talking about getting a high score, just passing, okay? Thousands of IMGs. And the struggle is lack of information and knowing the use of how to use the correct information to apply to this test. Remember at the beginning, declare yourself knowledge bankrupt. Throw away your ego and allow yourself to learn this brand new information. Listen, when I came to America almost 15 years ago, I didn't know anything. I didn't know anything about the healthcare system in America. I was stupid. I was naive. Although I was a smart kid in my country when I came from Nigeria, but when I got to America, I said to myself, this is a new country. I never lived in this country. I wasn't born in this country. I don't know what they do in this country. I don't know how they do things in this country. So guess what? I am now going to go on a journey to ask as many people as possible to tell me how they do things here. Because how I did things back home in my country is not how they do things here. And that is the only way I was able to grow and learn. If you have that mindset, you are going to learn more. You are going to become better. Now, is it going to take time? Yes. But time is everything. But if you have bad information, if you have preconceived notions, you're going to struggle. Okay? Remember, the USMLE is not a memorization exam. People have tried to memorize this test. It is impossible. The exam is 30% memorization, 70% critical thinking and application. The more you know how to apply concepts, the easier your life is going to be. Now, over the last 10 years, they've removed buzzwords from the exam. There's no more buzzwords in the USMLE. Like current jelly sputum, you're not going to see that in the test anymore. They're going to describe to you. They might just say patient has hemoptysis. They're not going to tell you the patient has current jelly sputum anymore. An alcoholic that's having hemoptysis, right? And it's probably, it might be Mallory-Weiss syndrome, but now they start describing the microbiology question, it's probably going to be Klebsiella. Because I know current jelly sputum is pretty much like coughing up blood. But they used to say current jelly, so they took it out. So they just said to an alcoholic that is coughing, having a hemoptysis episode, right? And they tell you about the stain and describe the bacteria to you, it's Klebsiella. You see how they're describing the clinical symptoms of the patient. Here's another big mistake a lot of IMGs make. Students in general, I don't even care, right? You're not using the Q-bank as a learning tool. Today, we are going to learn how to use the question bank as a learning tool, okay? Now, I hear a lot of people say it all the time. Dr. Adishina, I talked to my friend, they told me to do UWorld First Aid and Pathoma, and I said, you are absolutely right. Those resources are absolutely freaking amazing. But if I give you a BMW and you don't know how to drive the car, you're going to wreck the car. So I see people that actually do question banks, and they tell me they've done it 2-3 times, and I say, how come you failed the USMLE? They say they don't know. I said, the reason why you failed the USMLE is because you, first of all, went through the question bank and wasted the question bank. Number two, the second time you went through the question bank, you never really try to understand why you're getting those questions right or wrong. And number three, you were just looking and observing the questions, not saying to yourself, why is this question written this way? What is the mechanism of action? What disease processes? What is the physiology behind this? What is the pathophysiology? What microorganisms? You weren't questioning yourself, and then you're just clicking answers and worry about a percentage on the actual question bank. So what ended up happening is by the time you go to the question bank the second time, and you're actually not taking the critical time to learn the information, you're just saying, oh, that answer was D, that answer was E. And then your score will go up because you've seen the question before. The first time you did it, maybe you got a low score. The second time, your score will automatically jump up to 70%. You know why? Because some of you don't have to read the question. You just click the answer because your brain can recognize it. It's called recall bias. But before you pick the answer, did you ask yourself, can I explain the pathology behind this question? Can I explain the mechanism of action behind the disease? Can I explain the side effect of this drug that we're testing? Can I explain what a cohort study is, a randomized controlled trial? What is clinical? Can I explain this before I pick my answer? And can I also say the explanation in my mind before I pick that answer the second time? And not saying, well, when I was doing my UWorld back, I remember that one was C. That was the C one. But no, that's the wrong way of doing it. Because if you take the USMLE, you're probably not going to do well. Now, let's talk about knowledge deficit. Some of us have been out of school for years. The longer you're out of the educational system, the harder it is for you to recall basic clinical information. You might be able to take care of patients at the bedside because you just seen patients, you can recognize somebody's got sinusitis, you got strep pharyngitis, somebody's got a pneumonia, you prescribe antibiotics for them. But that's different. On the USMLE, the information is granular. They're asking what's happening inside the cytoplasm and mitochondria. You don't use that in the clinical practice. Step 2 is application of what you learned in step 1 with management. And there's an order to the step of management. So if you miss the step of management, you're still going to do poorly, even though you're a clinician. Now, if you're a medical student in the Caribbean islands and you did not get a solid foundation of knowledge before you attempt to take step 1, then a question bank is not going to fill that gap. That's the number one reason people jump into the question bank and they come out of the question bank and they still don't know much because they're like, I don't remember the basic physiology of action potential. I don't understand my molecular biology. I don't understand my micro. I don't understand my path. I don't understand pathophysiology. Well, it doesn't, then when they read the explanation in the question bank, if you don't understand how the explanation is written, because you're supposed to learn from the question bank. So if you never learned that, so you missed another step. So the question bank was supposed to teach you, but if you didn't use it as a teaching tool and you're more worried about, oh my God, I just got to get the correct answer, then you've misused the question bank. And guess what happens? You're stuck. So that's why I always explain to people, like, the knowledge that you need to have a solid foundation. You can build the question bank and now fine tune your knowledge that you're missing. And eventually over time, you're going to do 3,500 questions. You're going to see the same concept tested in different ways. And then you're going to be able to master the information. So if you're missing that knowledge deficit, you need to go and relearn it and then start applying using the question bank to be able to learn. Okay. Explanation are the key to success. We're going to talk about that later. Okay. So for some of you already at Smash USM Review, you know, I talk about the EASE method all the time and the checkpoint system. Now, if you're watching this live on YouTube or Instagram, right, the EASE method is, I use the word ease for a reason because it's supposed to make your life easy. Remember, I told the exam is like literally 50% strategy, 50% application, and then 30% of the whole exam is memorization, and 70% is application of critical knowledge. So the problem is if you don't know the strategy, you are going to struggle. It's like playing chess. The exam is literally designed a specific way. Remember, your goal on this exam is to answer this question, every question on the test, accurately, precisely, right? So every anatomy of the USMLE question, every USMLE question kind of looks like this. There's always a lead-in, right? What's the most common cause? They'll ask you, what is the next step in management? What's the best step in management? What's the mechanism of action? What's the treatment? What's the side effect? What's the adverse drug reaction? Or they can ask you a biostatistical question where you ask you to calculate, you know, the odds ratio, calculates, you know, the relative risk, like calculates the sensitivity, specificity, you know, ask you like all the Swiss cheese model, right? They want you to know all this information. It could just be a question about just communication between the patient. End of life, DNR, right? They can ask you Medicare, Medicaid. All these questions are all fair game. Or psychiatric question where they ask you the side effects of, you know, clozapine or antipsychotics or, malignant hyperthermia. All these questions are fair game in every facet of the game. But they all follow the same pretty much standard format because the question writers are given a template for them to write the questions. So they don't write them randomly. And after they've written all those questions, they actually go on a board and the board has to sit down and review all those questions and see if it's too hard, it's too easy for you guys to understand. And then they are finally handpicked and selected to be able to be tested inside the USMLE exam. And then after that, they verify them and say, you know what, this question is good. Let's start using it. And each exam always has a stamp, right? He has a stamp. You can see right here. There's a body, it's a leading. That's what boils down to the question, right? There's always distractors. They always put a bunch of distractors in there to try to distract you, right? Don't fall for it. Key associations, we're going to talk about it and identify it. They always tell you, it's always starts as it's a case, a 45-year-old female, a 25-year-old male, right? Caucasian. They might tell you, listen, when they tell you somebody's Caucasian, it's not an accident, guys, because there are diseases that's going to be finding white people that's not finding black people. Like cystic fibrosis is more common in Caucasian people. Ashkenazi Jews, right, have, Chariots part in their macula, right? So they have, Tay-Sachs disease is common in Ashkenazi Jews. There's a reason why they put it that way. Does that make sense? So if they're saying it's a 10-year-old black boy, they didn't put the black or African American, that's a black, they didn't say African American. The exam is racist. It's not racist. It's just, they want you to know that there are diseases that's common in some races than other races. So you should pay attention to those things. It's not an accident. every single line in each question is written with specificity for a reason. And everything is in first aid and your textbook, right? So here's typical classic board question, but we're going to go over the ease method real quick. So the ease method, right? E means examine. We're going to look at the last line and we're going to do a bunch of questions together and we're going to practice this. And I want to show you how easy this thing is, right? But I'm also going to give you tips of why it works every single time. Okay. And what I do when I do questions, I've been doing this. I've done step 1, step 2 CK, step 3. I've done my internal exams in residency. I did my oral boards in emergency medicine. I did my written boards in emergency medicine, and I still use the same concept. So I'm not telling you because I've never used this before. I've been using this all my life, and it worked. So if I'm teaching you, that's why open your mind to possibilities. At the beginning, when you first start using it, it's going to be difficult. You're going to feel like a little hesitancy, but it's okay. Over time, it gets easier the more you use it. Okay. So check this out. We're going to find the last line of the vignette. We're going to find association by finding all the relevant top concepts. And then we're going to summarize the entire case in one line. That's a difficult concept to master. And I'll tell you in a minute. And we're going to ensure that you make the right diagnosis and management. And guess what? We're going to move on. All right. So now let's apply this concept. So this is Smash USMLE Cuban. For some of you guys who are not part of Smash USMLE, okay, this is Smash USMLE Cuban. It was written by over 30 physicians. We put it together. If you're in my program, you have access to my QBank. We're going to do some questions together today. So I want to see participation, all right? I'm going to be checking the chat right here to make sure you guys are participating. Let me pull up my chat so I can see the answers you guys are telling me. Let's pull up the chat. Perfect. Because I want to see. All right. So I see here. All right, guys. So we're going to do a few questions together. But now let's look at the first question here. All right. Now, remember, I told you we're going to apply the ease method. The first thing is when you look at any case on the USMLE, first of all, before you guys take this exam, of course, whether they're using UWorld, Lecturio, Amboss, Smash USMLE, it doesn't matter. Everybody pretty much has the, most at least Amboss doesn't have the design and the look. So that's the only thing I don't like about Amboss. But for the most part, like you want to kind of get used to the familiarity of the design of the USMLE Cuban. Okay. So, okay, I think I got some space here. I can put this here. Okay. So here's the deal. Okay, so you guys can see. Perfect. Now, let me zoom this out so I can see. All right, perfect. So remember, the first thing we want to do is, don't start from the beginning, please. Never start by reading the case from the start, okay? Because all our lives, we've always read question from the top. Like it's called what I call the Z method, right? Everybody reads from the top to the bottom. That's going to be time waster on the exam. And even if you're doing the questions for practice, and here's my tip for you guys. If you guys are doing the USMLE question bank, whether UWorld, Smash USMLE, I don't care what QBank you're using, okay? All the QBanks are going to teach you what you need to know. The information is there. The question is, are you learning it? That's basically what it boils down to. So here's the deal. When you are doing, this is an important, write this down, guys. This is important. If you're doing your question bank for the first time, I want you to do it in tutor mode. Let me say that again. If you are doing so, like if this is Smash USMLE review website. So let me I like to show demos. So, we have our strategy, video lectures, QBank, all right? So for you guys who are using the Smash USMLE reviews to study, when you go on the QBank, and let's say you want to do pathology question, right? Let's say you want to do some path questions. It takes about a couple of seconds to load here because I'm sharing my screen. It might just be a little slow. There you go. So you will see in the question bank, there's 4 options. There's time, on time, tutor, and time tutor. If it's your very first time of doing questions, okay, remember, it is a learning tool. Don't be fooled by what people are saying online, on Reddit and whatnot. Like you're supposed to use this question to learn. So pick tutor mode, okay, and pick whatever subject, behavioral science, biostatistics, whatever, right? And when you do it in tutor mode, you're going to be slow. I'm not going to lie to you. It's going to be slow because you're going to be, doing these questions one at a time, and it's going to feel like it's taking forever. If you're doing 40 question block, it's going to take you about 4 hours, 3 to 4 hours, a minimum to finish one block. So that's a long time. So let's do the math. Let's do the math together. If we're doing, right, where's my calculator here? Because sometimes, people don't, let's see here. If you're doing 40 questions and it takes you 4 hours per block, right? if you do 4,000 questions, let's even say, that would take you almost like, how many hours is that? Somebody better do the math for me, but it's going to take a lot of hours, pretty much, right? Let's just presume that. Let me see if I can find my calculator here. All right, I'll drag it over here. Okay, I found it. Okay, so let's do the math. Let's say we're doing 40 question blocks. It takes 4 hours to do, right? And let's assume we're doing 4,000 questions divided by 40 times 4 hours. That's 400 hours. Let's put that in perspective. I like you guys to understand the perspective, right? So here's the thing. You are going to spend close to 400 hours to do the question bank the first time. That's a lot of time. Right? So when I tell you it's going to take a while to get through just the first round of finishing the Q bank, it is going to take a while. Maybe 300 hours. But it's probably less than, it's like 3,000 questions. But you understand what I'm saying? So you need to factor that and not be emotionally drained and feel discouraged because it's taking too long. Because we're in the age of Instagram and Facebook and everything has to be instantaneous. And I'm even talking about people who are learning. Because if you do passive learning, it's going to take even longer. So that's my first tip for you today, okay? So let's go back to the question that we're supposed to practice, okay? So we're gonna read the last line. The last 2 lines is rectal exams reveal no mass, no gross blood, but she's guaiac positive. What is the most likely source of her bleeding? All right. Now, the first thing we want to do is glance at the options. I see AV malformation, colon cancer, diverticulosis, infectious colitis, and ulcerative colitis. I don't even know, but it looks like some kind of bleeding problem is this question. You know what I always say when I look at this? I say this is a GI question. Now, why is that important that you guys need to get used to that? Every time before you do any question, you are going to look at the answer choices first once you highlight, because it immediately allows you to narrow everything down in your brain to just one concept. At the end of this question, this is going to be some kind of GI question. So I don't have to worry about maybe immunology. Maybe I might have to, because maybe there'll be some connection. Sometimes you have to find a connection, but this is what they want me to know. Okay, good. Then what I'm going to do next, I'm going to start at the top. I'm going to say we have a 33-year-old. And here's the thing, guys. Notice what I'm doing. I am highlighting. The highlight functionality is your best friend from now to eternity till you're done with this exam and beyond. Always, always use the highlight. You see, I always tell people, if you drive a BMW or a Mercedes-Benz, right, it has all these buttons inside of it. Like this one is for, air vents and cooling. This is for, heated seats. All this is inside the car. Now, if you drive a Honda Civic, right, it doesn't come with that, right? But just think about it for a second. Do you think it was an accident that the USMLE organization put a highlight button inside the Q-Bank? Just think about it. Did you think they just felt it wasn't important? No, they want to make your life easy. So don't say, well, I don't like the highlight thing, no, they gave it to help you. You see, they could have designed the Q-Bank without highlight functionality. They could have designed the Q-Bank without for you to cross out options. But because it's a standardized test, right, they are trying to help you pass this exam without any hardship. If you know the information, you're going to pass. So let's do it. 33-year-old woman present complaint of painless rectal bleeding. So that is always the chief complaint. Every disease has a chief complaint, right? On 3 occasions in the last 6 months, she noticed moderate amount of red blood in the toilet after a bowel movement. She denies any abdominal pain, constipation, diarrhea, weight loss. On exam, you notice telangiectasias of the lip and oral mucous membranes. On exam, she reports her father has the similar red spots on his lips. Now I'm going to read the last line again. The rectal exam now reviews no mass, no gross blood, but she's still guaiac positive. What is the most likely source of our bleeding? Now I'm going to ask you guys first. We've already done what? We've examined the last line. We've found the associations. Now let us summarize the case. The summary of this case is a 33-year-old female with painless bleeding that has telangiectasias, and she's guaiac positive. Now, before you answer the question, what is the diagnosis? Because this is the next step, right? You've made the summary. Now, what I just did is going to be difficult for you at first. And the reason why it's going to be difficult for you at first is if you never heard the disease before, it's going to be tough for you to come up with the exact answer. But you have to start practicing it. You see, practice doesn't make perfect. Practice make you better and eventually become a master. I tell people all the time, anytime you're learning any new information or a new skill, I call this new skill sets. New skill sets, just like the day you learn how to drive, took you some time to learn how to drive, right? But now you guys are driving, you're on your iPhone, you're talking, you're texting, don't text and drive, you're watching YouTube, you're doing all this thing, and you're still driving, you're eating chips or something like that, and you're driving. But the first time you drove, it was difficult. You had both hands on the handle of the as a driver, you're looking at the mirror, you're checking everything. Now it's a reflex. The same thing with the USMLE guys. When you first start using this simple concept I teach you, it is going to be hard. It's going to feel like, it's just a hassle. Why can't I just read it the way I've always read the questions? Because it's not going to work for you on the exam day. It's not going to work for you as you're practicing 3,000 questions. It's a big, you have to fall in a big mistake. Now, I want to see answers, guys. What is the diagnosis, guys? I want to see answer choices of what is the diagnosis, not the answer. What is the diagnosis of this condition they're describing in this case? A 33-year-old woman with guide pauses, painless rectal bleeding that has telangiectasis at lips and oral mucous membranes. So Celestine's got some answers here. I want to see, what you guys think. Let me check on, let's check on YouTube, what our YouTube audience is saying. And Instagram, what do you guys think on Instagram, guys? Okay, I see a bunch of answers. All right, I see Maui Mess Cutie here. It says GI. Okay, so all right, let me see what people are saying on YouTube. Guys, don't be ashamed. It's okay. It's okay. We are all learning together, guys. All right, let's see. All right, nobody on YouTube is trying to take it a shot. Okay, so I see one answer here. Dr. Celestine says HHT, hereditary hemorrhagic telangiectasias. Right? Yashika Dixon said the same thing. Hereditary telangiectasia, Osler-Weber-Rendu syndrome. Osler-Weber-Rendu syndrome. Let me say that again. Osler-Weber-Rendu syndrome. That is the diagnosis. So you see what they did? They gave you a case of a patient that has Osler-Weber-Rendu, that has a GI bleed. And now they're asking you, what is the most likely cause of bleeding in patient that has Osler-Weber-Rendu syndrome or hereditary telangiectasias? Now you might say, oh my goodness, I've never heard Osler-Weber-Rendu before or hereditary telangiectasias. So here's the deal. Now I'm going to show you how, before we even pick the answer, let's go into our first state to see if that information is in first state. Okay? Because this is now how your first aid will help you. The problem with first aid is I wish they just took every single case in first aid, facts in first aid and turned them into a question, and we can just all read it and move on with our lives. But they didn't do that. They just throw a bunch of facts together in the book, and they want me to freaking memorize it. Well, it doesn't work, right? We didn't go to medical school and use first aid. We went to medical school and read Goyen and Robbins and, and all this big textbook. That's what we read in medical school. How come now I got to study for a USMLE exam that tests me on everything and you put them in the little chunk of information facts? Okay. So let me share my screen here and let me put up Osler-Weber-Rendu syndrome. Let me share my screen here. First aid. Boom. So this is first aid, guys. So when I use first aid, it's very simple. What I do is I just type in what I'm looking for. Number one, this will save you a lot of time. Okay, it will save you a lot of time than flipping through the book. All right. And I search Osler-Weber-Rendu, and let's see if I can find. Oh, there it is. So perfect. All right. Let me zoom this out for some of you guys can see. This is found in cardiology section of first aid. And look, it's just a small section, right? Hereditary hemorrhagic telangiectasias, also known as Osler-Weber-Rendu syndrome. Now, look at all the information they just gave you about Osler-Weber-Rendu. All they said is it's an autosomal dominant disorder of blood vessels. And what ended up happening is you have blanching lesions of telangiectasias on the skin and the mucous membranes. Well, here's the problem. Your mucous membrane is your mouth, your nose, your lips. You see, they didn't even say lips in first aid. But in the question bank, you see how we describe the disease? That is why I tell you, we are going to describe the disease on the test for you, because we're not going to use buzzwords. Recurrence epistaxis, recurrent nosebleeds, skin discoloration, and guess what? AV malformations and GI bleed and hematuria. Let me explain this disease to you guys now. This is a disease that people have abnormal blood vessels. Let me see if I can draw this. So here's your blood vessel. Remember, you have an artery. Artery becomes arterioles. Arterioles become capillaries. Where are we? Come on, buddy. Let's pick the red. All right. They become capillaries. And from capillaries, you form into venules and then big veins. Okay. So here's the problem with patients that have, the problem is you inherit it from your parents. It's got to be autosomal dominant, not autosomal recessive, right? Autosomal dominant. It's not a sex-linked disease. It's autosome. We have chromosomes 1 to 23, right? Chromosome 23, right? 1 to 22 are autosomes. So when you pick one of these guys, a dominant gene, even if you pick one, you're going to have the disease. So for you, if you're reading this, you first need to understand the genetics first, knowing that if I inherit from my dad or my mom and it's an autosomal dominant disease, because it's a dominant gene, I am going to present with symptoms of the disease. That's important. But you have weak vessels. The vessels are weak. You have abnormal connection between your arterial, your capillaries and your venules, right? Arterial venous, right? Between your arteries and your veins. But remember, arteries becomes arterioles, arterioles becomes capillaries. So between that connection, you start forming these weird looking abnormal connections between these blood vessels, right? And the problem is they're not well connected. So guess what they do? They break open and they bleed easily. And when they bleed, it depends on the location of where those AV malformations are. If they're in your GI tract, you are going to have blood in your stool. It's not going to hurt. Guess what? In the emergency department, I've taken care of so many people that have AV malformations. This is typically what they do. They'll come into the ER. They say, "Doc, I have a GI bleed." I'm like, "Guys, is it black stool or bright red?" They're like, "Doc, you know, it's bright red. Does it hurt?" No. Okay, so I'm thinking to myself, acute diverticulosis, right? Cancer, right? Or AV malformations. I'm thinking that. And then they say, "Doc," I tell them, I stick my finger in their bottom and I check for blood in their stool. And if it's positive, I'm like, "You have a GI bleed. Here's what I'm going to do. I'm going to check your hemoglobin. If their hemoglobin is 7 or 6, I'm going to give them blood transfusion in the ER. That's what I do. I do a Tapper's cross to make sure they have the correct blood mass, and then I admit them to the hospital after I give them blood. If they're stable hemodynamically, which means their blood pressure is normal, they're not tachycardic, because they're not hypovolemic shock from their bleeding, I admit them to the hospital, and guess what's going to happen? The GI doctor is going to see them upstairs on the medical search floor, and when you guys match as residents, you're going to witness all this stuff. And then we're going to take a camera, we're going to do an endoscopy, and then we're going to look into their esophagus and look all the way into their duodenum, into their stomach. And we're looking for the source of bleeding. And then if we don't find it through an endoscopy, we take a camera to their rectum and go all the way into the large intestine to look for this bleeding. And sometimes we can't find it. And the patient say, "You know what? They scope me top to bottom. They even give me a camera. That's a little camera we give patients to swallow. They'll swallow. The camera literally spins at almost like every single angle, takes pictures, thousands of pictures to find a spot. And guess what? These AV malformations are so difficult to diagnose. But sometimes you can find them. When you find them, you're like, "Oh my God, this is what's bleeding." And you cauterize them and you stop them from bleeding. And the problem with this patient is they get chronic anemia. So here's the deal. The patient will come back with recurrent GI bleeding over and over and say, "Doc, I have AV malformations." And when you look at their lips, they do have those telangiectasias. under their lips. That's Osler-Weber-Rendu syndrome. The problem is they just inherited some bad genes from their parent. So guess what? If I take those AV malformation, this little guy, and I put it inside your colon, you're going to bleed. If I put it inside your nose, you are going to bleed. That is why they have recurrent nosebleeds. If I put them inside your bladder, right? Here's the bladder. If I put them in the bladder, guess what's going to happen? You are going to bleed. You're going to have hematuria, GI bleeding, recurrent nosebleeds. Now, if you are studying this for the USMLE, for example, this is one question. Are you able to explain everything I just said before you click skip and move on? That's my question for you. Because my next question is, I'm going to test you on hematuria. I'm going to test you on the genetic problem of Osler-Weber-Rendu syndrome. Because right here in first stage, look. Where am I? Looking for my telangiectasias. For the guys on IG Live, they might have to get that's why I told them to come back on. Okay, we're going to go back on Instagram. Okay. All right. So let me see if I can, right? Osler-Weber-Rendu syndrome, guys. Now, let me clear this up. It's a mess here now. Now, look at this. Look at this. Look at this. Check this out. In genetics, remember, I didn't go to genetics early. I just went straight to disease and explained to you what the problem is. In genetics, they now give you all these diseases that have autosomal dominant diseases. Achondroplasia, polycystic kidney disease, familial adenomatous polyposis syndrome, people that have all these polyps and they have colon cancer. Familial hypercholesterol, they just mumbled all the diseases that have autosomal dominant. But the problem is if you memorize that, you're going to forget it. But if you understand the disease, look at what they threw in there. Hereditary hemorrhagic telangiectasias. Sitting right there in your first day. The first time you read it, you're probably just gonna be like, oh, this is just a bunch of diseases. But what's more important is understanding each disease and what's associated with them and what the signs and symptoms are gonna present with the USMLE and the concept they're gonna test you on. And then you can reverse engineer the information and say, oh, I know what von Hippel-Lindau syndrome. Those are the guys that get renal cell carcinoma. They got the VHL mutation. You see that? Rather than saying, oh, let me memorize all the autosomal dominant disease, you're wasting your time. Now, this is just one concept in first aid, but that we just spent time on. Now, you can see where the answer is now. You see, I can now pick my correct answer as AV malformation, right? And now that's the correct answer. You see the amount of knowledge I had to have before I picked that right answer. Now, if it's your first time of doing the question and you don't know hereditary telangiectasia, there's nothing wrong with that. Matter of fact, that's how it's supposed to be. Because if you've never seen the disease before, I got to share my screen, sorry. Right? If you've never seen the disease before, now you've learned a brand new disease. Now, I don't need to read all this explanation to myself because I just explained to you from first aid, right? But look, this is where you now start to learn. You say, oh my gosh, Osler-Weber-Rendu, hereditary hemorrhagic telangiectasias, right? You have to take your time to read the explanation, right? AVM is very common in patients that have HHT syndrome. But now you go into your first aid like we did earlier and confirm that the explanation matches what's in first aid. And then you can take a small little note, AVMs, cause of bleeding in HHT. That's your summary. That's it. That's the fact. Honestly, you say, oh, HHT also is known as Osler-Weber-Rendu because on the exam, they will not use Osler-Weber-Rendu. They'll use it as HHT. So not only do you have to know it as Osler-Weber-Rendu, you should know HHT as a disease because that's what they're doing on the test, guys. They'll flip the names for you back and forth, back and forth. So if you know one name, they'll flip it. Okay? But don't hate the game. Just enjoy the game. It's easy, right? So see here. Then once you have now read the explanation of the disease that we just learned, now go over the incorrect answer choices. Colon cancer, diverticulosis, infectious colitis, ulcerative colitis. Read them and find out why. And then look right here. Remember, I didn't even look at this answer of this question yet. These are random questions I just picked. Do you see what I say here? These patients have chronic bleeding requiring iron supplements and sometimes what? Blood transfusions. I get to do this all the time in the ER. I give this patient literally iron. Like I said, okay, here's 325 milligrams of iron sulfate, and you can take this because you're going to have what? Iron deficiency anemia. So the next question I'm going to test you on this same disease is the MCV is going to be like 65. And now I'm going to test you what kind of, anemia do they have? They have iron deficiency anemia from chronic AV malformation bleeding. You see how I can say the same concept and turn it into a hematology question, right? So for some of you guys on Instagram, if it's not clear, you're not going to be able to see because I'm sharing my screen. Click the link in the med school link and join me live on Zoom. This is a live Zoom call we're doing right now. So you're not going to be able to see very well because Instagram is terrible. They don't let us share screen very well, so I can't do it. But if you're watching me live on Instagram, click the link, join me on Instagram, register, and then you will get access to see it much, much better. Okay? Let me see if you have any questions here. Okay. All right. Now, let's pick another one. All right. Let's see what we got. Oh, good one. All right. Here's another case. Now, another thing I wanted to get over is the fear of getting questions wrong. This is the secret to scoring 270. I'm telling you, don't be afraid of questions. Don't, right? Because it's an opportunity for you to learn something new. Don't be afraid. It's okay to have a little anxiety, like, oh gosh, this question, oh God, but don't be afraid of it, right? Say to yourself, what do you got? What's coming? I want to know. I can't wait to learn. You see, that's a growth mindset. Like, what topic is this? What concept is this? When you guys are doing questions, you get excited. Don't say, oh my gosh, I don't want that. Why did they ask me that? Oh no, that's a difficult concept. They're always doing that to me. That is the wrong mindset. You want to have a growth mindset. You want to say, so what? Okay, what concept is that? Show me. What is it? I want to know. Right? Oh, why don't I know that yet? Come on, let's get it. You see, when you say that to yourself, what you're saying is, I am not afraid of anything you're going to throw at me on the test. I am willing to learn as much as I can. That is your mindset you guys have to have when you're studying for this exam. When you create that attitude is everything. Some people are going to have a negative attitude because they're like, oh my God, this is just horrible. Oh, why did, it's always, 21 hydroxylase question or beta hydroxylase question. Why do they always test me on that? I don't like that question. Nobody cares if you like the questions or not. The practice that you need to know this information. Does this make sense, guys? Don't be afraid. It's okay. This is practice. It's not the real thing. On the USMLE, your day is coming when you click that answer, you cannot go back and change it. When you click submit on the final exam day, that is your only one shot at it. Okay? So check this out. Let's use the same concept again. We're going to read the last line of the questions. Okay? Somebody's asking for the Zoom link. Can the med school guy just tell them, pin it and tell them to click the link in the bio to join me live on Zoom? If you guys are watching on Instagram, join me live on Zoom. There's a link in this. If you go to @SmashUSMLE or there's a Zoom link in there. Join me right there, and I'll be able to see you guys on Zoom. Okay. All right, check this out. Let's do this question. Read the last line. Which of the following disease processes might the physician be concerned to look for in this patient? I'm like, well, I don't know what the physician is looking for, but let's find out. And then I see here hyperparathyroidism, papillary thyroid carcinoma, pituitary adenoma, subacute thyroiditis, Dollinger-Ellison syndrome. Here's the first question. What kind of subject is this, guys? I just want to know the subject. We're practicing together, right? Don't tell me the answer. I want you to just tell me what subject is this. All right, thank you. I see Simrat said endocrine. Good. Celeste said endocrine. Thank you. See, now we've simplified it to one subject. I don't care about any other subject. I don't care about repro. I don't care about anything. I only care about this is going to be some kind of endocrinology question. Thank God, at least I know that. That's easy, right? Let's take baby steps. It's okay to take baby steps. All right. We got to learn to crawl before we run, before we fly. Okay. Now that I know this is going to be an endocrine question, because let me tell you the secret. On the USMLE exam day, the questions are all randomized. Biostats, genetics, biochemistry, physiology, pathology, like, cardio, endocrine. That's how every question is like that. So the more you practice, These little baby steps I'm teaching you, where I'm telling you literally step by step, all you need to do is this an endocrine question? Great, right? And then you're like, okay, what subject, what concept in endocrine is this gonna be on? That's gonna be a next question. You see, it's a logic. So now let's read the question from the top again. We're gonna highlight, we're gonna say 49-year-old man is found with a solitary neck nodule on physical exam. That's always your chief complaint, right? Lab reviews elevated calcitonin level and fine needle aspiration confirmed the diagnosis of medullary thyroid carcinoma of the thyroid. Now they're asking you, which of the following disease process might the physician be concerned to look for? Now that we know it's an endocrine question, what particular concept in endocrine is this? Okay, I want to see, just put it on the chat. All right, I see Simrat MEN2 syndrome. You see, MEN syndrome, multiple endocrine neoplasias. Let's break that word into what is part. Multiple, that means there's multiple things going on inside your body at the same time. Endocrine, it's an endocrine problem. Neoplasias, cause some kind of neoplastic syndrome is going on in your body. And there's MEN1, MEN2B, 2A, right? So now, even if you don't know multiple endocrine neoplasias yet, right? You can say to yourself, all right, I don't know MEN syndrome. You see, that's you recognizing your knowledge deficit. And sometimes it's not easy to identify your knowledge deficit. That's why sometimes you need a tutor, a coach to be able to tell you. You see the difference? Because another challenge you might run into while you're studying is you not recognizing your knowledge deficit. And if you don't recognize it, you're going to keep fumbling around for a little bit. See, that's why, in Smash USMLE, I have tutors for you. Your tutor will be like, do you know MEN syndrome? Now, if you know MEN syndrome, explain MEN syndrome to me. What kind of MEN syndromes do we have? And what are the diseases that align in MEN1, MEN2A, MEN2B, right? Tell me. Does that make sense? Because then somebody's allowing you, they're helping you identify what you don't know. Does it make sense, guys? So check this out. Before we answer the question, let's go back into our first aid and find multiple endocrine neoplasias. Let me see if I can find it. First aid, let's find MEN2. All right, okay. Let me see if I can find multiple endocrine neoplasias. Let's search for that. Endocrine. All right, here you go. Actually, multiple endocrine. Don't worry, I'll share my screen with you guys. Neoplasia. Okay, perfect. I found it. So let me share my screen. All right. So this is the point where you now start to learn information. All right. You see this section in first aid is so high yield. Oh my gosh. How many of you have done UWorld Q-Bank and see MEN syndrome like 10 times? Or do my Q-Bank and see multiple times? Or how many of you? Say yes in the chat. Say yes in the chat if you see MEN syndrome everywhere when you actually guys are studying for boards. It's everywhere, right? To the point that it starts to annoy you after a while, right? You're like, my gosh, I get it. I get it. You want me to know MEN syndrome. It's one of the highest yield concepts on the boards. They love it. You know why? It's because it's a disease that has multiple parts, and they can always take two and give you, tell me one, or they take one and tell me two. So it's an easy question to write for USMLE writers. So if you're studying for boards and you have not memorized, mastered, and the problem is it's a combination of, okay, so here's another thing we need to talk about, okay? So in my course, like when you guys get coaching, one of the things I tell you, we teach you is, on the USMLE, there's something called concept-based, right, and fact-based. This is a perfect example of what I call a dual study strategy. A dual study strategy means it's a concept-based and it's also a fact-based. Now, let me explain that. So they're talking about multiple endocrine neoplasias, and they tell there's MEN1, MEN2, and MEN2B, right? So you see here, right, that of course there's it's a autosomal dominant disease, right? So obviously they can test you on genetics of it. You see that? So you got to know that. But remember, when you memorize autosomal dominant, autosomal recessive, know the disease first and then know the mode of inheritance. Don't do it backwards. Okay. Now look at what they did here. You see MEN1 has pituitary tumors where you have hyperprolactinemia or elevated growth hormone production. Now, the second tumor I can find in your body is in your pancreas. A pancreatic tumor like Zollinger-Ellison syndrome, insulinomas or VIPomas or glucagenomas, which is even rare, but it's a pancreatic tumor. This is easy because remember, your pancreas makes insulin, right? So when you have a little insulinoma inside your pancreas, guess what's going to happen? They're going to present with hypoglycemia. Zollinger-Ellison syndrome, too much gas strain, you're going to have a lot of gastric ulcer disease. So although you might be memorizing, be careful. You might be memorizing just pancreatic tumor. On the exam, I'm going to describe a patient that has Zollinger-Ellison syndrome that's going to present with peptic ulcer disease to you. You see? Or give you a patient that's having recurrent hypoglycemia that's not on insulin and it's not diabetic. So be careful. I can trick you. And then the third tumor is in your parathyroid, right behind your thyroid gland. So when you have a parathyroid adenoma, that's really too much parathyroid hormones. You're going to be hypercalcemic. You got a problem, right? You might have kidney stone. A lot of constipation from hyperparathyroidism, right? Stone, groans, right? Hypercalcemia. But look, the disease also has associations though. That's the problem. Associated mutation of the MEN1, right? That's easy because it's MEN1, right? That's menin. It's a tumor suppressor gene on chromosome 11, right? So not only do they want you to know that the disease is associated with a mutation. So before you start memorizing the 3 Ps, know that there's a tumor suppressor gene mutation that these patients are undergoing. That's why, because they don't have a tumor suppressor, they're forming all the stupid tumors all over their bodies. Pituitary gland, pancreas, parathyroid, right? So they have angiofibromas, collagenomas, and meningiomas. These are the other tumors also associated with. So because they have all these different kind of, tumors like meningioma of the brain, right? Collagenomas of their collagen. It's easy for me to write questions on it. Super easy. I can continue to screw you up as many times as possible. You feel me? Now, look at MEN2A. MEN2A has an overlap, right? It's the parathyroid one. They both have parathyroid hyperplasia. And guess what? The only problem with this MEN2A is they have that medullary thyroid carcinoma. If you're going to have any cancer in the world, don't get medullary thyroid. You can get papillary carcinoma, papillary thyroid cancer. That one is easy to treat. This medullary thyroid carcinoma is bad because it's a cancer of parafollicular C cells. And they produce a lot of calcitonin. That's why in the case, they're telling the patient has hypercalcitonemia, whatever. If that's the favorite word, a lot of calcitonin because it's coming from the parafollicular C cells. What I can do is I can redirect that question and ask you which cells are producing it for the test. And if you don't remember the parafollicular C cells, then you're screwed. That's a histology question, right? Look, they're telling you prophylactic thyroidectomy is required. You know what that means? Even if I find that cancer inside of you, I don't even care you ever having symptoms of this disease, it hasn't metastasized, I'm just going to take your thyroid out prophylactically because I know it's a bad cancer. We're going to take it out. But when I take it out, so you're going to become hypothyroid and have to put your levothyroxine for the rest of your life. Okay? And then you get Theo. Oh my goodness. You know that they love Theo, right? Oh my gosh. Of course they love Theo. Right? Neuroclass cell problem, secretes catecholamines. But the problem is he also has an association. There's a mutation problem. Is that RET, right? That's the receptor tyrosine kinase that codes for receptor, right? That RET oncogene mutation. So know the mutation, right? But check this out. The last one, MEN2B, which is easy, like medullary thyroid cancer is kind of overlapping. So if you look at this, if I were you, I'll draw this thing out. So I know that pituitary pancreas, and when I get to the second circle, parathyroid is common between both of them. Look, when I draw the third circle, medullary thyroid is coming between, MEN2A and 2B, and then pheochromocytoma also. And then finally, mucosal neuromas. On my board exam, actually, they asked me about this mucosal neuromas. And the question was testing me on this intestinal ganglion neuromatosis. That was the option. I was like, damn. Come on, guys. They never put mucosal neuromas on there for my MEN2B questions. They put on intestinal ganglion neuromatosis. Okay? But this one is easy because that's the one that has marfanoid habitus. Okay? And also a mutation regimen. So now, this is a high yield question, guys. They love it. They will ask you. It's going to be in your test. Know it. But know it very well, because don't just memorize the 3 Ps. The 3 Ps means nothing. But that's just for you to recognize. I mean, that will allow you to answer some free questions. But guess what? I can ask you about prolactinemia, right? Patient is going to have a lot of milk, excessive milk production. You see that? Elevated growth hormone, gigantism, right? What does that tumor actually cause in a patient? What does pancreatic tumors cause? What does pheochromocytoma look like? Cause palpitations, hypertension, malignant hypertension in patients. You see, they become tachycardic because they have too much what? Epinephrine and norepinephrine. You see what I'm saying? Understanding the disease well enough and knowing that when you put them together in a little pot and they call them a bunch of syndromes. So now let's go answer our questions. Now that we know the one is going to be meant 2A, right? Let's share my screen again. I hope we're learning something today. All right, let me get back. Okay. So we said men 2A. So this patient, they already gave us 2 of the diseases. They said patient has medullary thyroid carcinoma of the thyroid, right? Let's see here, elevated calcitonin level. So they already told us that, right? And they're asking us, we're going to find the patient's going to be what? Hyperparathyroid, right? Because I just told you parathyroid hyperplasia. But look, you see how they flipped the answer, right? They didn't put parathyroid hyperplasia in the question in my Q bank. I didn't do that. Because I want you to know what parathyroid hyperplasia causes. Does that make sense now? That's why now the answer is hyperparathyroidism. So if you just memorize, parathyroid hyperplasia, you're like, well, there's no parathyroid hyperplasia here. Well, that's not what I want you to memorize. I want you to understand what is parathyroid hyperplasia. What does it cause in the patient? Patient that have a bunch of PTH being produced by a tumor that's not being regulated, that's just doing whatever it wants, you're going to have what? Elevated hypercalcemia. Then you take your time to read all this explanation. And then you write your little notes, a little summary inside your first aid. And now, as you go over more questions, you're going to see men 1A, men 1, men 2A, men 2B over and over. And eventually you master, you're like, okay, I got all the men syndromes now because they love to test it. But now you're learning 2 information. You just learned about hyperparathyroidism. Does that make sense? You just learned, like if you go through men 1, you're like, oh, now I know that men 1 has angiofibromas, cholangiomas. They can test me on this extra additional disease. And I need to know that menin, which is the tumor suppressor gene for men 1. So not only are you learning 1 information, you're learning 3 new information, because in your next set of questions, you're going to do the Q bank, which is just repetition of pretty much the same concept. We're just kind of, testing on different associations. You're going to see the same thing over and over. If this makes sense to you guys, say yes in the chat. If this is making sense to you guys, I want you to say yes in the chat. Okay? Was this helpful? Was this helpful for you guys? Because, I see time and time and over. Now, let's not talk about, because I'm talking about an approach to getting that 270, right? 270 is a very hard score to get. It's only the top 0.1% of people get that, probably less than 1%. Now, we're going to talk about content deficit. You see, one of the things I also realize is, whether it's UWorld, First, RX, Amboss, right? Somebody wrote the explanation for you, but they wrote it in such a way that you should be able to understand it. But let's say you have not taken the time out to understand the disease yourself because you don't know the disease. So even if you read the explanation, it may not sink in well because someone has not taken the time out to explain it to you. That is where you use videos to substitute your learning. I see people all the time, they watch videos and I'm like, okay, what did you watch the video for? It's not an entertainment. It's not just for you to watch it and have fun and say, oh my God. No, you're supposed to watch and then go out and apply what you know. So if you go to smashyoursmle.com, this is my course, right? So some of you guys who are watching that live on Instagram right now, or you're watching on YouTube, right? If you want to sign up for my program, go to smashyoursmle.com and you can sign up for the program /enroll. But look, this is where I now say, all right, I don't know men syndrome, right? I just been out of school. This men thing, why they always testing me on men thing? It's okay. There's nothing wrong with that. Let me share my screen now. Let me share my screen. Let me pull this up. There we go. So here's smashyoursmle.com. And when you guys come to smashyoursmle.com, you see right here that, this is an entire platform that I put together for you to make your USMLE learning easy. Sometimes people don't even know how to use it. So I want to show you how to use it. Because sometimes you're like, well, I'm doing my self-paced thing and I don't know how to use this platform. And I said, okay, this is easy. I just showed you how when you're doing questions. So when you have a schedule, and some of you are like, oh, schedule. I need to have a schedule. Of course, you're supposed to have a schedule, right? Because if you were doing your schedule and you're going through first aid, block by block, section by section, what you find out is the day you're going to do this topic is coming. And when you hit that topic, you're going to have one or two options. Are you going to do the questions on it? Or are you just going to, do videos to learn? Now, videos, when you use videos to learn, you have to be very strategic when you're using videos to learn. If you've been out of school for a long time and you need to rewatch all videos and then do questions, but don't just watch the videos, do questions every day. Because what people are afraid of is, well, if I watch this video, how can I really do this specific question in that video? Because that's all I want to do. And you're like, okay, you can't really do that. But you're doing endocrine subject. And don't get trapped in the dogma that, oh, I only want to do what I know, because you're going to learn everything and everything is connected. Like, just think about men's syndrome, for example. It's an endocrine problem, but it's testing on multiple different endocrine pathologies. So as you're going through my course, of course, we're going to talk about hyperparathyroidism at some point. We're going to talk about pituitary tumors at some point in the program. We're going to talk about this disease, pancreatic tumors. You're going to learn them. But then at some point, I'm like, you got to put it together. Because when you get to men 1, men 2, men 2B, it's all going to come together because they're all integrated. So if you sign up for the course, you're going to have access to my study strategy course, my mastermind course, which is mind blowing. Oh my God. If you missed this, this is like, I think it was like almost 3 hours of like just lectures where I put together on understanding USMLE mastermind. And you can create your schedule here. We have our coaches that work with you one-on-one to do that for you. Okay. And then I'll show you my notes later. But let's go to step 1 video, which is this right here. So let's say you want to learn Men 1, and you can see the way my website is designed. I actually designed it based on first aid because I don't want you to do too much work. We're about to upgrade this website and it's going to be mind blowing. What's coming? Oh my goodness. The next, I think probably 3 or 4 months, we're revamping the website. It's going to be beautiful. It's going to be a masterpiece. I cannot wait. So I'm going to type in Men syndrome, multiple endocrine neoplasia syndrome. You see that? So let's say you were doing the question and you said, you know what, let me go see what Dr. Additional said about this disease. Boom. You click on that and the website will load the video for you directly, straight to the video. Okay. Now, one of the things you're going to notice in the video is that I have an 18-minute video for you on Man syndrome. And then I draw out things for you. And then I explain it to you. I give you my little excitement on how to learn this disease without being like this little boring, hello, everybody, right? My lectures are way more exciting because I love medicine and I simplify it, right? But look, right here, you see the page number in first aid where we are teaching you from. So you can go into your first aid and literally be looking at that chart and be studying as you go along. And here's the beauty of the game. You can actually increase the speed of the video right here up to 2 times the speed, maybe 1.5 times to speed it up. So you can maybe like 10 minutes, you can finish this video if you put it at speed. And literally 10 minutes, I've gone over everything with you. Now you can now apply what you know. Because the next time you're reading your first aid, you can say, oh, I watched a little video lecture. I remember Men 1, Men 2B, Men 3. I'm sorry, Men 2 and Men 2B. Right? And all the things that are associated with that. So I go over that concept easily for you. That is how you use videos. Now, if you go to my website, you see right here, like we've covered, this is carcinoid syndrome, insulinoma, Zollinger-Ellison syndrome, gastrinoma, right? We talk about pituitary, thyroiditis, thyroid storm, acromegaly, SIADH, hyperthyroidism, hypothyroidism. I cover all these diseases for you in a lecture format so that as you're doing your question bank, when you're stuck and you have that knowledge gap and you feel like, oh my God, I don't understand it, go back and watch a simple video. It's short, it's quick. It allows you to retain the concept faster. Take a little notes while you're doing it. Now, what I also do for you is I give you my step 1 notes. Okay. So right here on the website for people who have access, this is not going to be available any longer soon. So while you join the course, you can see I have access to my PDFs. That's going to be going away soon because we're having the book to be printed out. It's going to be amazing. Anyway, all right. So check this out. This is my own step 1 book. And my step 1 book is detailed. It's not like first aid, right? You see, use your first aid, but this is like this is actually a real book you can read, right? All right. This is actually a real book. And let's say, Rick, look, I give you the explanation with pictures and everything. And you can actually read it and be like, okay, now I know what I'm reading. right? It becomes an adjunct to what you're practicing, okay? Does this make sense, guys? So that you can be like, I give you everything that will make your life easy, okay? So much easier. And this is your endocrine, right? And then you get to, drugs, and then we talk about endocrine physiology. And this is how you utilize the platform. Now, let's say in the evening, you just want to practice some flashcards, right? You go to flashcard section, right? And you say, all right, I just want to do some endocrine flashcards, right? Just kind of brush up. So you come here and you pick endocrine. Boom, 358 flashcards. And then you can practice and you can review just in the evening. So your day should be broken down into doing questions or watching videos, whichever comes first, right? Because one of the challenges is a lot of people want to read their first data at first. I'm like, how can you read the first data? You can't read the first data the first time, right? You have to kind of start watching videos, fill in the information, take your own notes, do questions, and then the book becomes better and better and better. Okay? Is it making sense? If this makes sense for you guys, let me know. Put it in the chat. Let me see it. I think some people might be asking questions on so the course is not free. Oh my goodness. Somebody say, is it free? Guys, this is not free. You got to pay for it. Okay. Like, this is knowledge that will change your life. You're going to become a doctor. Okay. All right. So we've covered a lot of information today. I'm going to take a couple minutes to answer some of the questions on YouTube and also here on our group here. Let me pull the Q&A section. I think we got a bunch of questions. So somebody said, is this course helpful for first-year students? So if you're a first-year student in medical school, if you're in the Caribbean Medical School, my course is a review for USMLE. When you're in medical school, they teach you a lot of information, right? So you're going to find it more helpful when you get to second year than first year, because first year is a lot of minutiae information, and you don't know pathology yet. Okay, so that's going to take some time. But by the time you get to second year, now if you're taking biochemistry in first year, my lectures will help you, but there's a lot of pathology on the website and you don't know pathology yet. Okay. So, I would say, definitely utilize it when you become a second year. Second year, definitely helpful. Let me pull up our YouTube people and see what questions people are asking on YouTube here. Okay. So here we have, we don't really have let's see. All right, good. So somebody says my third time seeing this information. All right, good. Now, for some of you who have not joined the program, because some people are like, all right, there's more to the program than this. All right. So if you're, some of you are already part of Smash USMLE Reviews, like I bring you guys these free sessions, and and some of you are getting my emails, and then you're probably like, oh my goodness. Somebody said, what's the difference between I-Form and the USMLE? So the I-Form on the USMLE website is different. It's different from the USMLE exam. That's another set of exams that's actually set by the USMLE organization. If it's required by a school, I don't know a lot of information about it because I don't test towards it. But if your school requires you to take it, and you have to, it's on their website. If you just go there, you see the I-Form information. But the USMLE is for people who want to match into US residencies. So you have to take step 1, step 2 CK, and step 3, and then OET, which is another exam you have to take before you can apply to residency and match. Most of the time, if you do well in step 1 and step 2 CK, like I tell a lot of people, that's good enough for you to be able to match. If you get a low score, let's say you apply and you didn't get enough interviews, or you got maybe 4 or 5 interviews and you didn't match, and you only have step 1 and step 2 CK, then go and take step 3, right? Because that's the only way you can improve your application, and do some research, right, between that gap year, right? So if you guys have a gap year, and another thing I want to talk about, like if you have a gap year and you feel like, oh my gosh, do something that's within the realm of academia or medicine, right? That's all they want to see, right? If you're working and doing research, if you're working with a doctor and shadowing them during your gap year, that carries a lot more weight, okay? Now, somebody said, what about the new step 1 that doesn't have the score in January? That's a beautiful question. So guys, let's quickly talk about this before I kind of share the last few things with you guys. Step 1 is going pass fail in January, okay? And to be honest with you, it's going to be great. It's good news and bad news. Here's the good news. Do you guys want the bad news first? Okay. The good news is the score is going away. Okay. So, but the bad news is this. And this is what and I think I've been telling people on Instagram, and this is what I presume. I've been actually keeping track of this and seeing what so the USMLE organization reached out to medical schools. And they actually had a webinar a couple of months ago. I actually was watching it on their website. And what ended up happening is that they asked the faculty at the US medical schools, like, we have this MBME assessment test. Will you still want us to have a score for the students? And everybody in the medical school say, the professors and the teachers, like, yeah, we want scores because that's the only thing we can go by. You know, it kind of really guides us. So because the medical schools in the United States still want a score in terms, you know, although it's going to say pass, fail, my presumption is right now the passing score for step one is not 194. I think they'll probably move that score up to 200. Okay, that's what I think. I may be wrong, but I think they'll move the score a little bit up to 200. But then what they'll probably say is if you get 200 and up, you pass the test. If you get below 200, you fail the test. Or they can still keep it at 194. It really depends. Now, they may not publish the score itself, but they have to have a number. Does that make sense? How else are you going to tell students they pass or fail a test, right? If there's no really score that you're going to go by, right? You've got to have a kind of arbitrary objective number that you have to use to screen your classes. If you say a class is pass, fail, right? Just like in medical school, they'll tell you it's a pass, fail class, but it's a cutoff number, right? Maybe it's at 70 or 80 or 75. So if you get a 75, they say you pass. If you get below that, you fail. I mean, it's brutal. Now, here's the thing though. It's not just only going to affect you guys as IMGs, because I keep hearing IMGs, oh, this is the end of the world. Oh my gosh, now we're not competitive anymore. We're not going to be able to apply to residency with a higher score, blah, 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 blah. And I said to myself, what are you guys talking about? Like, what do you think is going to happen to US students? If you're applying to dermatology, now you're telling me my step one score is going to just be pass. If I'm applying to orthopedics, and normally I know I need to get that 240 to be competitive for orthopedics, now it's just going to say pass, fail. Does that make sense? So even for US students who are applying for competitive specialty, or any specialty, but most specialty has a certain cutoff. Some of them don't, but a lot of them, you know, the more competitive I always have a score that they look at, be honest with you. You know, some of them say they don't, they look at the overall application. Some of them do, you know, but every program is different. But they've always used that score as a screening tool to be able to say, all right, we've got 1,000 applications. I'm only going to interview 300 or 150 or 200, right? So what I presume is, well, we're going to have a number that they're going to use. And the only thing is that step 2 CK is going to be the new step 1. Now, why is that a problem? Let's say you study for step 1 and you guys are studying in June right now, and you're going to take the next one in January or February, and it's the pass-fail version. Let's assume you put in just enough work to pass. Let's just hypothetically, you just put in enough work. You only study enough, you didn't put a lot of work, just enough, and you pass the test. Now, that's going to be good news for step 1. This is what I've noticed when people take step 2 CK. When people come to me and say the traditional step 2 CK is hard, I laugh at them. And I'm not laughing at, you know, I'm not making fun of you, but I know the reason why they say step 2 CK is harder. If you score low in step 1, what you don't realize is step 2 CK is just step 1 with management. And I didn't go over that inside this webinar. I can show you guys that it's actually true. And actually, I did a webinar with my students a couple months ago where we did a step 2 CK course. And I just how to use step 2 CK and study for step 2 CK and step 3. And I actually showed them that all these concepts, right, are going to that are on step 1. I've literally lost probably 70% of them are going to show up on step 2 CK. All those diseases, guess what? Hypothyroidism, SIADH, you know, carcinoid syndrome. They're all the same disease you're going to see on step 2 CK, guys. Does that make sense? So what ended up happening is if you don't do very, very well on step 1 and your basics and your clinical sciences is weak, now forget the biochem, forget the genetics, forget all that stuff. That stuff is gone for step 1. You're never going to see those stuff again. But for step 2 CK and step 3, those things will hunt you down. Because if you don't understand how diabetic ketoacidosis really happens, guess what's going to be a step 2 CK? Does that make sense? I'm just speaking endocrine, because we just did endocrine right now. See, that's going to be a challenge moving forward, because now step 2 CK right now, the average is 240. So when it goes pass fail next year, I can't wait. You better be hitting 240. And that's the average for step 2 CK, because now that's your competitive edge when you apply to residency as an IMG, right? And then probably you have to take step 3 also. right? But let's see how it works out. You may just need to pass, fail, and then because what end up happening is if your score is good enough in step 2 CK, then you're going to be fine when you guys apply to residence. So Jalen is asking, what are the chances of a second test taker IMD to match into residency? Does that make us less competitive? All right. So here's the deal. What kind of residency are you applying for, Jalen? That's the important question. You are still going to match. I'm going to have Dr. Fumi. She's going to be coming to talk to us probably next week or next 2 weeks. She went to Ross. I believe she got like I'm not going to tell you a score because I want you to come to the webinar and hear it for yourself. All right. But she didn't match the first time, and she got a low score and she reapplied again and matched the second time. All right. So, and I've seen people that failed multiple times and matched. Is it harder? Yes. But, is it possible? Of course, it happens all the time. People match every year. Okay. So, those are the things you need to understand. So if you're applying, you are just in the same boat, just like US students. So don't feel like you're less competitive, guys. I know it feels like, oh my God, step 1 is going pass, fail, and now I'm not going to be competitive. What do you mean? Like, now the first year, here's the interesting thing I'm thinking about. And I got to talk to some of these program directors and see what they say. I'm going to ask one of the program directors at my hospital what she thinks is because the people still have scores that are going to be applying next cycle. And some people are going to ask pass fail. I'm curious to what they're going to do. They're not going to have any other choice because if you get a high score and somebody got a pass, they will have to throw away the score for the next applying 2022 cycle. I guess 2023, sorry. Okay, because then they cannot look at the score. Does that make sense, guys? So if somebody who has a score and somebody has a pass for next year applies, they cannot favor somebody who has a score for somebody who has a pass because the exam is not passed. It's not your fault because US students who are going to be taking pass-fail exam are going to have the pass on their step 1. So what's going to be interesting though for US students also that you don't know is US students typically only apply to resident with step 1 scores. Now they're going to be forced to take step 2 CK. That's the challenge for them. They're going to run into trouble too because they can't just think about it. If I want to get to dermatology or ophthalmology or vascular surgery, you really think I'm going to apply with a pass score? No. That's not going to cut it because everybody has a pass. So US students now are going to be forced to take step 2 CK, just like you do. Because I went to a US medical school and that's what happens. I took my step 1 and step 2 CK when I applied, but for emergency medicine, I got 17 interviews when I applied to residency. But what I'm telling you is that US students have the same predicament. If they apply to competitive specialty, they're going to take their step 1 and step 2 CK and making sure they crush their step 2 CK with freaking high scores if they want to match into like super competitive specialty. Not the family medicine, not the pediatrics and all those stuff. Maybe that's not a big deal. But, if it's competitive specialty, you better bet they're taking step 2 CK just like you are, which means you better be prepared to do very well on your step 2 CK. This is important information for everybody. Okay, but if you're applying this year, you just need your scores. Okay. So here's the thing. I'm gonna share my screen because I have one more thing to share with you guys before we wrap it up. We've covered a lot of things today. Okay. Let me see if I can pull my screen up. Was this helpful? Put yes in the chat if you guys think this is helpful. I just want to make sure. Let me share my screen. There we go. All right. So let me pull my screen up. All right, awesome. So Jalen, if you want to email me, this is my email. Okay. If you have a question, like a particular question regarding like what residency you're applying to, here's my email, dradition@ftplectures.com. Okay. Someone said they want to buy the notes. We might have to, we haven't created that option there, but that's something we probably have to create later for you guys if somebody want to buy the notes. Because the book is coming out. We are printing the book probably next 2 or 3 months. It will be available on the website for people to buy the full book. Let me share my screen one more before we wrap it up for today. Because I want to share with you guys. This is very important. Okay. So students, I see a bunch of questions here. People are asking here, how can I join Smash USMLE? How do I, join the program? Listen, it's very simple. Right? This is what you get when you actually join the program. Okay. So I have a 4-week live hybrid masterclass plus a self-paced course for step 1 or step 2 CK. Okay. We give you a lifetime membership, which is actually 10 years. That will be going away very soon. So you might want to take advantage of this offer before it goes away, because we're not going to be offering lifetime membership that long anymore. Or the self-paced version, where you guys can literally just get access to all the self-paced lectures. Okay. So here's what you get. All right. You're going to get 19 subjects covering online USMLE Step 1 and some Step 2 CK Masterclass. It's 94 hours. It's amazing. If you've never joined my masterclass before, if you think what I just taught you today was something, wait till you see my masterclass. I literally go through cases that way and I explain the concept. That's what the masterclass is, right? Rather than saying, okay, let's talk about hypothyroidism, I'm going to give you a case and we're going to dissect it and we're going to break it down and I'm going to teach you the pathophysiology behind it. Just like we talk about Osler-Weber-Rendu syndrome, we talk about multiple endocrine neoplasias. Even for some of you guys that attended today, please don't make sure you don't forget any of those bunnies I just gave you today, because when you see those questions, I want you to pick in the right answer. Okay, never ever forget them again. Okay, all right. So has a value. It's 94 hours. It's 30-day review course. Listen, it's one of the most. It's the best masterclass out there. You've never seen anything like this before. No program is offering a masterclass like this. You can ask some of the students in my program who have attended masterclass. They will tell you it was the best thing they've ever done. Literally, what I did is I condensed first aid into like clinical cases, and we went through it subject by subject by subject by subject. And literally in 30 days, we covered pretty much 80 to 90% of what's in first aid. It's freaking amazing. Okay, that's a value of $4,997. And then you get access to quizzes after the class, bro. You know, for the master class, almost 1,200 Step 1 practice quizzes. I'm going to get access to my Smart MD training course, right? Part of what I taught you today is part of the Smart MD training course. So for some of you guys who have not joined it and kind of know what the Smart MD is, we talk about strategy, mastery, application of clinical concept, rapid review, and test data secrets. It's, you know, there's so much. I can't even go over it in an hour, okay? That's a $1997 value. I'm going to give you a sample schedule for 6 to 12 weeks that you can download for free, but my coach is going to work with you. They're going to work with you one-on-one and actually break things down for you and actually create your own customized schedule. Although you have a template that you can go by if you have the self-paced course. That's a $97 value, guys. My notes, $497 value notes. This notes what I showed you earlier. See, I broke everything down and explained everything to you so that even if you don't want to take notes, you can just use my notes and copy and paste them, you know, from the PDF. All right. Then you get access to my Smart MD WhatsApp group, right? If you're part of my Smart, if you're not part of the WhatsApp group, you are missing out in life. All right. I'm just being honest with you, because you can ask my students. This is the only program. Smash USM is the only program in the entire planet that has a WhatsApp group where I share information with you. I give you live updates of what's going on by the USMLE. I motivate you. I give you video lectures. I do all these things for you so that you can be up to date. Being an IMG is tough, guys. It's hard, right? Especially if you're studying by yourself at home. You want to be a part of a family of people that got your back. People are from multiple study partners, right? You guys can put them in the chat. I see some of our students in the Zoom call right now, right? They have study groups together where people are joining together. That's the benefit. You're not going to find that. Rather than going on the internet and looking for people to work with you, you're going to find people who are already studying for the USMLE who are serious about this to help you and work together. That's a $2,997 value. I'm going to give you my daily study tips. I just give you just a snippet. What I give you today is just a little bit. There's so much more I want you to learn. When you join the program, that's going to be available to you. That's a $997 value. You got 24/7 email support. My staff is available to respond by email when your WhatsApp group to be able to respond to you. Okay. You also get my USMLE exam day study strategy rituals. Okay. Literally, before you take the test, I give you this bonus and also my 2-hour USMLE exam day, how to save time on the exam. Remember, I told you this exam is 50% strategy, 50% application. Okay. All right. Then I'm going to give you how to dissect USMLE question webinar. Okay. I actually don't cover this. We didn't talk about checkpoints. We didn't talk about, code switches here inside this webinar today. And if you want to learn more, you're going to get access to this webinar. Okay. And also, this is what you're going to get as the full package. Okay. You're going to get my masterclass, my ebooks, my how to dissect USMLE webinar, my exam day. That has a value of $16,797 value. Now, if you want access to my self-paced course, right, you're going to get over 7 or 8 video lectures. That's 220 hours, literally. It condenses packed. You can see, I think I showed you guys a demo already on the website. I have a Step 2 CK program and a Step 1 program, $4,997 value. Okay, you get access to my Cuban. I think we just saw it today. We did the Step 1 Cuban. Next time, I'm probably going to do the Step 2 Cuban so you guys can see it. That's a $997 value. There are 2 separate packages, right? Step 1 and Step 2 CK. You also get my study strategy course for $497 value. You get my how you lecture notes. But if you're taking Step 2 CK, you don't need that because that's my Step 1 book. I recommend Yale G First Aid, Crush USMLE Step 2 CK, Step 3 book. You get it for free. Literally, we ship it to your house. If you're international, you got to pay for shipping. But if you're local in the US, we're actually going to send the book to you directly to your house. It's a $57 value book. You're going to get a private coaching call. So all my students get a one-on-one coaching call with their coach, and who's going to work. And you get 4 hours of free coaching. You get the lifetime package. And like I said, the lifetime package is going away. All right. You get my USMLE Prep audio book, the study plan for $97 value. My Insider Secrets to Scoring 260 ebooks, a $97 value book. And also my high yield flashcards, $297 value. And my How to Prepare for the USMLE ebook for $397 value. And the Smart MD WhatsApp group, like I told you, is nothing like you ever seen before. Trust me, you will want to be part of this group. You will want to be part of this group. Trust me. It's a $997 value. You're still getting my daily study tips, $997 value, and 24-hour email support. Okay. That also has a value of $16,797. However, listen, if you join the program today, you can get the combined package. I call it the Platinum Plan, right? It's the 4-week life hybrid masterclass plus the self-paced course. Okay, for USMLE Step 1 or Step 2 CK, all right? You can get that for one-time payment of $14.97 or 3 easy payments of $597. This is the best investment you're going to be making in your life. Trust me. I've met students who have already gone to Kaplan. They've gone to, use all these programs, and they're still struggling. And I've had students that came to my program, they have struggled, they failed the USMLE, they've matched into residency. And I can show you testimonials on my website right now to show you all the students that have used my program and they've matched into residency. I just did a 7-hour webinar literally in April, where I invited 7 of them to come and talk to us. And we have a video recording of that. You can also see under the testimonial, literally, they use the program and they've passed. All you need to do right now is go to smashusmle.com/enroll, and you can join the program today. Like I said, the lifetime membership is going away. This gives you 10 years access to my course. So don't be fooled with the 4 weeks live hybrid masterclass. You still get access to the videos because they're recorded, okay? Or you can get the self-paced course and get started today for one-time payment of $997 or 2 easy payments of $597, okay? Just go to this link right now, take a screenshot, okay? smashusmle.com/enroll. And I'm gonna show you exactly how to do it. It's really, really easy, okay? So literally, let me show you exactly how you guys can enroll for the course right now. For some of you still watching me live on YouTube or Facebook, all right? Let me share my screen here. So if you go to smashusmle.com/enroll, you're gonna land on this page here, and then you'll be able to sign up for the program, okay? And when you actually join the program, you can see right here on the page, all right? Like I said, this package is not gonna be available for long. The lifetime membership actually is gonna be closing soon, so we're gonna be getting rid of it, okay? And the price might even go up. So literally here, you can see you have 2 options. You can get the Platinum Bundle, which is gonna give you access to my 4-week live hybrid masterclass course. Classes every day at 5 p.m. Eastern time. All right. And it goes to about 2.5 to 3 hours. Pharmacology is about 4 hours long. So it starts at 4 p.m. All right. This is everything you're going to get. Okay. So you just click on this button right here, and then you can select this package, or you can pick the self-paced package, which is just going to give you the self-paced access right here. Okay. And when you get to this page, it's really simple. Now, some student might say, okay, what if I just want the masterclass by itself? I don't want the self-paced course. We have that option for you guys. All right. So basically you scroll down and you can pick just the 4-week live hybrid masterclass right here. It's $997 if you just want the masterclass only. If you want the combined, because if you buy separate, you end up paying $2,000. So it saves you about $500 if you get the combined package for $1497. All right. Now, all you have to do is just pick right here which course you're studying for, Step 1 or Step 2 CK. And then we're starting the program actually started yesterday. So if you still want to join we can still plug into the course. You're going to miss yesterday's class, or you can pick any of these dates. Here's different dates for the whole year. So the class is every month. Literally, it's a live hybrid, which means you're not going to be able to ask me questions directly during class, but there's a live physician moderator that's there that's going to be able to answer all your questions. You can type it in there in the chat and we'll be able to answer all your questions. Trust me, this is going to change your life. This is the course that you want to be part of. Like, it's changed so many people's lives. By the time they join my program, they say, Dr. Adesina, why did I not know about you earlier? That's what I get all the time. All right. Now, if you scroll down to the bottom of this page and you're like, well, Dr. Adesina, I want to hear about other people's testimonials. Of course, right here are the people that match into residency for my program this year. Amanda, she got a 235 on Step 2 CK after using my program. She's a nurse. She matched into emergency medicine and internal medicine this year. And she's from Canada. She's an IMG, okay? This is Taylor. Taylor actually was an IMG. She failed Step 1, took my program. She passed step 1 and step 2 CK. She matched into family medicine. All right. And Rashida also failed step 1 twice. She failed complex twice, complex once, USMLE step 1 once. So she failed the exam twice and then came to my program, passed, and now she matched into family medicine this year. Barbara also failed step 2 CK. She took my program, and here's one of their testimonials. This is Taylor. This is Dr. Badio. This is Amanda, right? They all took my program. This is Monica. She took the program and she passed the course. This is Damien. This is Dr. Fabricio. This is Jeet. He's actually one of our tutors now after taking my program. Francisco. These are all the people that have taken my program and passed. And look at all their testimonials, right? You know, I mean, this is kind of success we have here at Smash USMLE. So there's no reason why you should hold back. And you know, people say, "Oh, this is too expensive. I can't afford it." I said, listen, every day you waste is every day you can get back. All right. It's not about the cost. It's about the value you're going to get. There's no program that you're going to find. And if you want to look at more reviews, you can check us out on Trustpilot. Okay. If you go to trustpilot.com and you want to see more reviews about Smash USMLE, of course you can go and check us out. You know, because some of you might be like, "I'm not sure about this program," right? Look, 72, we got 4.5-star reviews. Go and read the reviews yourself and see how amazing the program is. Like, this course has changed people's lives, right? And what I'm telling you right now is when you join, I'm committed to you 120%. I want you to be successful. I am passionate about you becoming a physician. That's why I do this program. I tell students all the time, I'm a board certified ER physician, but I want you to match into residency. I want you to become a better doctor. I want to make medicine simple for you. One of the frustrating things for me is people go to Caribbean schools, no disrespect, right? And they come out and they feel like they don't know anything. I say, how did you pay $200,000 to a Caribbean medical school and you don't remember anything? Or you don't know how to study for step 1. You don't know how to know, you didn't learn medicine. Did you ask for your money back from the school? Like, you're going to be taking care of people's lives here, guys. People's lives is at stake. What we do here at Smash USM is making sure when you walk into the hospital, you know what you're doing. When you match into residents, I want you to equip you with the knowledge and the skill that would transcend and help your patients. I don't want you to go out there and kill patients. I don't want you to go out there and hurt patients. You need to know this information. So invest in education, invest in the training that will allow you to become a better physician, invest in yourself, because that's the only thing nobody can ever take away from you. Okay. I spent over $500,000 to get here. I didn't look at the cost. I didn't say, "Oh my gosh, I don't have the money." I borrowed money. I borrowed money literally to go to medical school. My parents couldn't afford to send me to medical school. They didn't have the money. Even, you know what's funny? My dad, when I got to medical school, he said, "Leke, how much is your tuition?" I said, "Dad, the first year they said it's $50,000. My dad said, "You're on your own. I ain't got that kind of money." He said, "I don't have that kind of money." Right? I said, "Dad, don't worry about it. I'm going to take it out of myself. I'm betting on myself. I'm going to finish this program. You don't worry about it." Right? I took out all the loan under my name. By the time I was finishing residency, my student loans was $300,000 plus. But the information that I know today, that's why I can come on this webinar and teach you this information. 10 years ago, I didn't know anything. I was stupid. I was dumb. I was an idiot. I was just walking around. I didn't know anything. Right? But when I went and invested in knowledge, guess what? I can never forget what I've learned. That's the beauty when you invest in knowledge, guys. So if you're watching this webinar right now, click the link. Go to smashusmle.com/enroll. Sign up for the program. You're going to get access to me like this, teach you live, you know, give you information like free webinars. I'm going to bring IMGs that come and motivate you. I give you resources. I give you the strategies. Okay. So join the program. Okay. There's nothing that should be stopping you right now. I'm going to put the link inside the chat for you guys. Let me look at some of the questions that people are asking. So if you have any questions for me, I've put my email here. Okay. I'm just going to answer. I think Simra said, if I take step 1 exam before January, am I going to compete for residency with those who took step 1 after January since it's past? I think I answered that question already, Simra. Yes. If you take the step before January, you're going to have a score, but then people who are also going to take after January is going to have a pass fail, but it's okay because they're going to probably ignore the score at that point in time. And then, you know, and then you have to take step 2 CK to have a score because now they're going to be looking at your step 2 CK score at that point. Okay. So listen, guys, we've covered a lot of information today. This is going to be a recorded webinar. If you want access to this webinar, I'm going to put it inside only our Smart MD WhatsApp group. Like, that's the beauty of our Smart MD WhatsApp group. They get access to these webinars like this. You're not going to find it anywhere else, and then they can't share it. And please don't share this webinar with anyone. Okay. So I'm going to put the link inside once the video recording is available. If you have any questions, listen, you can call our number. Okay. You can call Paula O'Reilly, 212-465-3339. That's our company number. If you have any questions, if you guys are watching, let me see. Look at Instagram. Can you repeat whether to go give up step one before pass fail? So if you're already studying for step one and you feel like you're going to be ready before this goes pass fail, it's okay to take it. Okay. If you're not going to be ready, then wait till it gets to pass fail and then take it when it's pass fail. Okay. I'm just looking at some of the questions that people are putting on Instagram right here. Okay. So listen, like, if you have any questions for me, guys, reach out to me in my email. I'm on Instagram at @USMLE Reviews. And I'm always available to answer you guys questions. I am committed to your progress and your success 120%. Now, this is what I tell students. When you join the program, I need you to commit 120%. This program is not going to work for you if you don't put in the work. Okay, it's a lot of work. You're going to study. It's not going to be as easy as you think, but I'm going to make it easier. You still got to study. You still got to come to class. You still got to read the notes. You still got to, get your coaching session, follow your schedule, do all the things that I teach in the program, because all the people that you see that were successful in the program, those are the people that passed and did the work. You still have to put the work. Okay. But remember, you're doing the work for yourself. There's no shortcut. I see people online looking for answers to MBMEs. And I'm like, why are you looking for answers to MBMEs? Well, now they're providing answers now when you guys take the MBME, right? You have to use the MBME as a guide, right? Because there's thousands of Q banks out there, from Smash USMLE, UWorld, First Aid, RX. Like, there's so many, Q banks that you can use to practice. The MBME is supposed to help you when you are studying to literally be a guide to tell you what you know and what you don't know. Okay. And that's one of the things we work with you one-on-one. Okay. This is a program that we work with you one-on-one to be able to guide you towards your success. And I promise you, if you put in the work, you're going to love it. You're going to be a success. You're going to match into residency. You're going to be a beautiful, amazing physician. I can see that all of you guys right now, you're looking at me. I'm telling you, it's possible. I was in your shoes about 10 years ago and I didn't know what I was doing. I reached out to people. I learned all the concepts. I put all this information together and I've created a program to be able to help other people. That's why I'm so passionate about your success. But listen, commit today. Every day that passes by is one day you can never get back. All right. Every hour, every minute that you waste not joining the program, start studying, getting the guide and guidance that you need. Remember, I'm not only going to help you with step 1 and step 2 CK. I'm going to help you through the residency application process where I'm giving you tips. I'm going to give you connection how to get clinical rotations, where to find research, where to do clinical trials. There's so much value that I give in my program, more than just, this is not just a USMLE prep company, right? This is where I train you to become a better physician. That's why you see the slogan, Smash USMLE Reviews, where I train you to become a better doctor. So click the link right now, join the program, invest in it. You can do it with a one-time payment of $14.97 for the combined program, or 3 easy payments of $5.97. Or you can do the self-paced course for one-time payment of $9.97 or 2 easy payments of $5.97. It is worth it. Absolutely. Trust me. You're going to look back and say, this is the best investment I ever made. Okay. All right, guys. Thank you so much for joining us today. I want to say shout outs to Med School Live for literally, hosting this event and literally allowing us to be able to, do this both on Instagram and, I was able to kind of do this. This is actually the first time I'm streaming on 3 different platforms. So it's been amazing. It's been fun. Like I said, if you have any questions, you can also email us at admin@smashusmlereviews.com. If you have any questions, you can DM me on Instagram. I'm always responding to all my DMs. If you want to email me directly, email me, ask me questions. And my team is ready to help you. Thank you so much for watching this today. The video will be available in the next few hours. We'll post it on our Smart MD WhatsApp group. Till I see you next time, I'm going to bring you more value. And I want you to promise you one thing. Listen, you can do this. Look at me right now. I came to America 15 years ago and people told me I can never become a doctor. Today I am one, right? People are going to doubt you. They're going to tell you you can't do something. Don't believe them. You're the captain of your own ship. You're the one that can write your own story. And I've seen this time and time again. Negative people in your life, you need to cut them out like this. Literally, cut them out of your life and literally focus. Surround yourself with people like me and my team and people who are in this program who will guide you, who will motivate you. That's how you become successful. Listen, success leaves clues. The problem is people are hanging out with people who have failed. Well, I got an email the other day. Somebody was telling me that somebody's asking advice from some doctor who's an IMG who never matched, who never passed the USMLE, is asking them how to take the USMLE. And I said, what kind of information do you think that person will give you? Somebody who never took the exam, somebody who never passed the test, who never matched. That's why I bring people to the program who went through the program, went through the process and matched and did it. That's the right person to ask information from. And stay away from these forums. I know it's very hard to stay away from them, but listen, you're gonna feel more depressed, more anxiety when you read these forums. Stick to what I teach you. It works. It really does. But if you put in the work, I promise you, I guarantee you, you're gonna be a success. You're gonna be a doctor. The road is hard. The journey is long. But look, guess what? You were designed to do this. You were born to become a doctor. Listen, your family, your mom, your dad, your parents, your brothers, your sisters, they are waiting on you. They're counting on you. Don't get tired. You're doing this for them. You're doing this for your patients in the future. You're doing it for people who say, doctor, so, you are the person who needs to take care of me when I'm sick. You're going to be a cardiologist, an endocrinologist, an internal medicine doctor, a dermatologist, an orthopedic surgeon. Whatever your dreams are, don't give up. Don't let people tell you you can't do something. I'm telling you, everybody I met in my life told me I couldn't do it. My professors in college said I wasn't good enough to get into medical school. Despite being a straight-A student in college, they said I won't pass the MCAT. I got rejected by 11 medical schools. I couldn't even afford to apply to a lot. I applied to 12. I only got one interview to medical school, and that was the only school I got into. You feel me? That is the only school, one interview for medical school, and I got in. So I always tell people, all you need is one residency interview to believe in you, and then you get it. They just need to put your name on the list. And your life changes forever. What are you willing to sacrifice to do that? Even if you sacrifice the next 2 years of your life to do it, is it worth it? Absolutely. To set yourself up for success for the rest of your life, to make that MD count, to make that MBBS count. Are you willing to do it? Will you? Look, you can see right here. When I finished residency, you guys might not be able to see my background there. That's what I got. That diploma, everywhere I go in the world right now, is what allows me to be able to practice medicine. And that's all you need, guys. Don't be tired. Don't give up. Don't feel like it's impossible. Nothing is impossible. Even the word impossible says, I am possible. I'm a Christian. I believe in God. Pray like your life depends on it, but work hard like your life also depends on it. And do what others wouldn't do today so you can have what others will not have tomorrow. This is how life is, guys. Do what others won't have today, won't do today, so you can have what others will not have tomorrow. People are not willing to work. They don't want to study. They don't want to do the work, or they work and they give up. And then they want to drag you down the same road that they took because they didn't do it. Don't listen to them, because you will be singing the same song 20, 30 years later, saying, I have an MBBS from my country and I'm working as a janitor. I'm working in the bookstore. I'm working at the group home. I'm working here and I have a doctorate degree and I can't even use it. And then you come to America and you feel like I wasted all my time saying here, I came here for the American dream and I give it up. I've seen thousands of people here in this country who are doctors in their country or went to the Caribbean island, got an MD degree, and they're not even practicing. And every day you feel with guilt, you feel with shame, you feel with agony. You feel like, wow, how did I spend 4 years of my life studying that much to get a degree that I never use? What's the point? And then you walk, every time you walk by a hospital, every time you see an ambulance drive by, it reminds you that you are only 1 or 2 steps away from getting inside that hospital. How do you feel? How does that make you feel? Knowing that you have the capability, you have the mind to be able to go into the operator room and operate on a patient, but you don't have the license. That is the worst situation anybody can be in life. Have a potential, have the ability, but somebody say you don't have a license because you didn't pass 2 or 3 exams. That's it. That's it. That's all that's going to stop you. The question is, what are you going to do? Are you going to watch this webinar and say, you know what, I'm not going to invest in the program? Or I'm going to say, my goodness, Dr. Adesina is speaking to me right now. I'm going to click right. I'm going to pull out my credit card. I'm going to buy the program. I'm going to invest in it because I want to wear a scrub. I want to have my name inscribed. It says cardiology. endocrinologists, infectious disease, internists. I want to be part of the 55-60% of people that are making it into the US healthcare system every single year. And they're practicing. I see them in the hospital and I'm so proud of them. I want to see you in the hallway. I want to be able to shake your hand and say, I am proud of you. You made it. That's what I want for you. I want the best for you. I'm tired of being the only Black person in the emergency department looking for other immigrants like me. I want to see you there. But are you going to come in? Are you willing to pay the price? Are you willing to do whatever it takes? Are you willing to do whatever it takes to be part of the best medicine on the planet? I'm speaking to you right now. You're looking at me. What are you going to do? Are you ready to join me? The journey was not easy. It was hard for me too. It was tough. There were days I was tired. So many days I was exhausted. Some days I'm like, I don't want to do this. But then it reminds me, I said, if I give up, what will my patients today do? If I give up, I'm giving up on my dreams and I'm going to disappoint myself and my family and the people that counted on me. And then my patients whose lives would depend on me when I walked into that day when they're sick. And it's only the thing that's going to save them is what's in my mind. And you know what? I'm thinking about 10,000 patients and I can tell you stories after story after story. And when I take care of a patient that's having a bad asthma attack and about to die, and because I was there, I was saving their lives. And I said, if this person was home and I wasn't here, would they be alive today? Nothing, no amount of money, no amount of anything can replace the joy and the excitement when you get to see that the knowledge you know is saving somebody's life. When you save a baby, I had a 6-month-old baby one time. The mother was screaming. They ran into the emergency department. Kid was brought from daycare. Kid had a febrile seizure, was hypoxia, ultrasound was 70%. I intubated a 6-month-old baby while working with 2 nurses and a tech. Saved the baby's life. You think that will ever leave me? I'll take that to the grave. I said, if I wasn't in the ER that day, that kid would have died of a febrile seizure. So I'm telling you, if I didn't have that knowledge and the skill set and gone through all this training, I wouldn't know what to do. But as soon as that kid walked in, I'm like, airway is not inside. Let's bag this kid. Let's intubate this kid. I intubated the child. I shipped him out. Kid did well the next day. I had another guy that coded, had Takashimbo cardiomyopathy, literally went into asystole and ventricular fibrillation. I resuscitated him for 1.5 hours. I put a chest tube. He had a tension pneumothorax. I put him on a amiodarone drip. It was an epinephrine drip. I cooled him down to 32, 34 degrees or 33 degrees. He woke up out of the ICU alive. He had Takashi. He was 40 years old. His son was 10 years old. The other son was 12 years old. I hugged his son. I actually hugged his wife, I meant to say, and I hugged his family, telling them, I don't think this guy's going to make it. He walked out of the hospital. You think that will ever leave me? Even my tech, people were telling me, why are you coding this patient for long? I said, he's only 40 years old. It's only a few years older than I am. Why would I give up on him? I saved his life. What are you going to do? Your day is coming where everything I'm teaching you right now will be the difference between what will separate death from killing your patient. Learn, it's okay. It's hard. It's hard now because you have to go through the hard stuff so your lives of your patients can be easier. But guess what? When you get to the destination where I'm at, your life will be so much easier. I guarantee, I promise you, they're gonna pay you $250,000 to $500,000 to do this. You don't think that's worth it? Your children get to go to a private school. You get to drive whatever car you want in your life, live in whatever house you want to live. And people are going to be jealous of you and look at you like, look at you, you're a doctor, you're driving a nice car. But they don't want to see you when you were working for 5-6 years, studying for the USMLE, busting your chops, starting to study every single day, investing in a course like this. They don't want to go through that. That's why I told you at the beginning, if you do what is hard, your life will be easy. If you do what is easy, your life will be hard. You just have a choice. Pick one. The choice is yours, but I don't want you to be 80 years old and look back and say, I wish I did that. That's what I don't want you to write your story at. Thank you so much for coming out today. I hope you learn one thing or the other. I am committed to your success. I want to see you succeed. You are going to be successful. You will match. I don't care how many times you apply, you are going to match. It's not going to be easy, but you are going to do it. You're going to put in the work. The work's not going to be easy. There's no instant gratification. There's no shortcut to the process. You're going to be a doctor. Becoming a doctor takes years of mastery and practice over. But if you do it the right way and you know the information, your patient will be glad you knew. You are going to be happy with your life. your dreams, when it finally comes true, you're going to say to yourself, I came to America. And I remember when I was in Nigeria, I said, if I can just step my foot in this country, I will do whatever it takes to make my dream come true. What I did not know, or what he didn't tell me, was all the obstacles I would go through to get there. But I promised my that 19-year-old boy when I was in Nigeria, and I said, God, if you just let me get to this place. I heard it's a land with flow with milk and honey, and I got to the street. Milk and honey is only found in Walmart. It's a joke. But I said, I want to be a part of the top 1% in America. I want to be part of 3% of people in America. Neither do I know it's one of the hardest things I've ever done in my life. Neither did I know that every time I shared that drill with somebody that never made it, they're going to tell me I couldn't do it. I didn't know that. But I already made up my mind that the only thing that's going to stop me is me dying. That's it. So I said, God, we're on a mission. I need your help, but I'm going to do the work. You just point me through the direction of the people who are going to walk me through the journey. And guess what? I started finding them. I started knocking on doors. I started looking for the people who had the dreams, who had the skills, who had the knowledge of what I was seeking for. And when I found them, I opened my mind up and I listened to everything, and I absorbed and I applied everything they told me. And I became successful. But they told me, after they told me, I realized it was even hard, but they make my life easier. You see, successful people look like they're successful because they learn from the failures of others and listen to the advice of the people who have come before them. Whatever you want to do in your life, somebody else already done it. There's nothing new under the sun. You're going to become an attendant like me one day. But remember, my journey was hard. I'm the only Black doctor in my entire generation. The only one. A Black male. That's it. So imagine the odds. I didn't have anybody in my family to go meet and ask them, listen, how do I become a doctor? I had to go to strangers. And God put those strangers in my life. And then when I got this, I finally finished. I said, I need to look back and help other people. So I built this course. Kaplan will charge you $4,000. They won't have a webinar like this for you. They won't give you a personal coach. I know the program. You can go buy Boards and Beyond, but are you going to have a personal webinar with the CEO of the company? How many of you have met the guy that owns UWorld? Has he ever hosted a webinar to come talk to you face to face like this? I don't think so. Has Pathoma ever sat down with anyone and said, let me come and tell you my story. Let me walk you through the journey? No. I want it to be different. I wanted to give you something different. I want you to listen to what I'm saying because it's coming straight deep down from me. And I want you to understand that your journey, no matter how hard it feels, it's not impossible. It may feel, at some point in my life, I felt everything was impossible. When I didn't get into medical school, I said, oh my God, my life is over. But then God made another way. And I found another chance and another chance. And every step of the way for the last 11 years that I went through the process, it was freaking hard. I was broke. I tell people, I didn't even have a television inside my apartment. I have a $50 chair and a table inside my apartment and the $50 bed I bought from a white guy that was living in my neighborhood. That's the only thing I had in 4 years of medical school. That's it. It was hard. I didn't tell you it was easy. But when I figured it out, and when I learned the information that God gave me the gift to be able to teach you in a way that's make your life easier, don't hold back. Click the link, go to smashusmle.com, enroll in the program. Let me change your life. I have people I look up to who made me who I am today by the grace of God. And I still give God all the glory. It's not me. But listen, the work has just begun. But you can do it. I know you've got it in you. I can see, I'm looking at you right now in this webinar. I know you got it in you. All right, guys. God bless you all. Seriously. I know you guys are going to make it. I want to see your success story at Smash USMLE. Till I see you guys next time, click the link. I see you guys at the top. God bless you. Have a wonderful evening. Bye-bye. All right, that brings us to the end of our webinar, folks. Thanks, guys, on IG. Thanks on YouTube. Take care. Bye-bye.